Hello and welcome to the Center for Child Counseling's second Family Law Mental Health Summit. My name is Eddie Stevens. I am on the board of directors of the Center for Child Counseling, and with me, my co-host for today's CLE attorney, Joe Considine. Joe, how you doing?
Hey, Eddie, thanks for asking me to co-host this with you and to benefit this great organization that does such good work um, in helping families and children. I just really honor the work that you do and they do. So we're gonna have a great seminar today.
Well, we have set aside many hours, and last year we focused on adverse childhood experience and tried to help create a trauma-informed community. This year, our focus is going to be assisting those, including ourselves, that are suffering from alcohol or other substance abuse, but we're going to be mainly looking at alcohol abuse today, and we have a number of speakers lined up, including our very first speaker, who will be discussing how you help a client and others with this type of program, our own Joe Considine.
Indeed. And let me throw in a pitch also for not just alcoholism. And Eddie, that's the importance of our talk today, because alcoholism is kind of 1999. The DSM-5 now is calling it substance use disorder, alcohol use disorder, trying to dispel the bad connotation, the shame around alcoholism. And the other thing I want to talk about, we're going to talk about co-occurring mental health disorders, which all of us as lawyers experience, certainly a number of us do, and certainly our clients do. So it's both going to be substance use disorder and co-occurring mental health disorders. So after you hear from me, then we're going to segue right into a pair of professionals in the field of recovery and treatment, two people that I know pretty well. I work with them on a regular basis, Deborah Kuzmin and Dr. John Dyben. Both of them are long-time professionals in the field of treatment for substance use disorder and co-occurring mental health disorder. They both bring unique experience to the work that they do. They work for the Hanley Center at Origins, and they're among the finest people that I know. They're not only well-trained, but they have big hearts, which you have to have when you're helping folks with these kinds of problems. So we'll look forward to hearing from Dr. Dyben and Deb Kuzmin.
And after that, we will hear from Dr. Scott Weinstein and Molly Paris, who are with the Florida Lawyer Assistance Program, and they will help us understand all the resources available to Florida lawyers.
And I want to give a shout out to my former law partner and mentor, Jim Robinson, who is a past Palm Beach County Bar Association president, who was instrumental in setting up that program many, many years ago. So it has its origins in Palm Beach County. So then after that, Eddie, I guess we're going to hear from our colleague, R.T. White. Is that correct?
Yes, we're going to be shooting 30 questions in 30 minutes, seeing if
and you're going to try to stump RT?
I am going to stump the RT, if possible.
RT needs no introduction other than the fact that maybe little known, but needs to be better known, is that he is quite a stand-up comedian.
I think everybody knows he's a comedian. And to close the CLE today, we have a very special discussion with the Florida Bar President, Dori Foster Morales, and the past chair of the Family Law Section, Laura Davis Smith, talking about attorney health and wellness, focusing on the pandemic and giving us some updates about the Florida Bar. And we're also going to make some special presentations every year. The Center for Child Counseling awards people in the legal community with some special acknowledgments, and we'll do that a little later as well. Without further ado, our first speaker of the day, you've already met him, He is truly the expert in the field of dealing with helping folks with substance abuse issues. Needs no further introduction. Ladies and gentlemen, Joe Considine.
Palm Beach County, although my practice takes me all over the state of Florida, but I've been practicing here since the early 1980s. My practice, for the most part, focuses on the area of mental health and substance use, both with regard to family law matters and more particularly the Marchman Act. So I want to thank Eddie Stevens and the Center for Child Counseling, and I want to just give kudos to both of them. The Center for Child Counseling just does such great work, and I know Eddie is so committed to the work that they do. They are helping our community get better and hopefully avoid some of the things that we're going to be talking about today because of the work that they're doing. So what we're going to talk about today is how can you help your client or her family member who struggles with addiction or alcoholism. We all have had clients who've come in who themselves either have a problem or one of their family members has a problem, and they may be coming in to see you as a family law attorney because for a divorce, because the person that they're with, their partner, has a terrible substance use disorder. So we're going to discuss that. We're going to discuss the scope of the problem that we have in this country with thousands and thousands of deaths, the opioid epidemic, the alcohol related death epidemic. We're going to talk about addiction and substance use disorder. We're going to talk about the neuroscience and how the brain is affected and changed, altered by repeated use of substances and how it can cool off with recovery and treatment. We're going to talk about the hijacked brain. We're going to talk about how we can help our clients and their family members, and we're going to talk about involuntary commitment to treatment using the Marchman Act as an effective tool. And what the science has told us is that involuntary commitment to treatment is at least as effective, if not more so, than voluntary treatment. And I'm going to share my screen. And so we're going to start now with getting the substance impaired individual the help that they need. And we're going to be talking about the Florida Substance Abuse Impairment Act. So the scope of the problem, so we're talking about substance use disorder and co-occurring mental health disorders. We're going to, we know the press and the media have been reporting for the last several years about this. So some of this you may know, but here's the hard numbers as reported by the Center for Disease Control. We've had 70 deaths from drugs in 1 year in 2018, 82,000 alcohol-related deaths in 1 year in 2018. In 1 year, these are more deaths from substances than all of our wars that we've been in since Vietnam, for the total of that. And that's just for 1 year of drug-related deaths or alcohol-related deaths. There's more deaths from alcohol and drugs in any year than from car accidents and gunshots and AIDS. So the scope of the problem is obviously extensive. SAMHSA, which is a good agency to get a lot of information from, tells us that there's 23 million Americans who have substance use disorders, which is defined as when there's a recurrent use of alcohol and or drugs, which causes significant, clinically significant impairment. 43 million Americans have some form of mental illness. So this is in this country, 23 million have a substance use disorder, 43 million have some form of mental illness, 8 million have both a substance use disorder and a co-occurring mental health disorder. 92 million Americans report binge drinking in 2018. 23 million adults report heavy alcohol usage. And these numbers are all from 2018. And about 14.5 million adults had significant alcohol use disorder, which we'll talk more about what that means. But less than 10% of that number received treatment. So you can see that's 12 or 13 million Americans have a significant alcohol impairment and do not receive treatment. Among mental health issues, anxiety disorder is the most reported. Depressive disorder is next. In my practice, I'm seeing psychosis that's coming from, that's drug induced, especially among the young with cannabis. And look, lawyers are not exempt from all of this. As you probably know, there was a study done in 2016, a joint study by the American Bar Association and the Hazelton Betty Ford Foundation that found that our problem, that our risk is higher than that of doctors, higher than that of the well-educated general workforce population, that in terms of self-reporting, 28% of new attorneys from 0 to 10 years in practice reported problematic drinking at the rate of 28%, so about a third of new attorneys. The number drops down a little bit overall to about 20% of all attorneys scored at a level consistent with problematic drinking. That's only for the highly educated workforce. They only score at 12%, and doctors are at 15%. The study concluded that, attorneys, that we experience problematic drinking that's hazardous, harmful, or otherwise generally consistent with alcohol use disorder at a rate much higher than the general population. And the same is true for depression, anxiety, and stress. So you have to be on guard about that. And we have a great program here in the state of Florida, FLA, Florida Lawyers Assistance. My former partner and mentor, Jim Robinson, was instrumental in forming FLA. So now we have to ask ourselves, what is addiction? And we know a number of bodies have defined it as a primary chronic neurobiological disease characterized by behaviors that include one or more of the following: impaired control over drug use, compulsive use, continued use despite harm, and craving. An addiction is actually the word that is used in by the general population. The folks in the mental health field have, under DSM-5, have changed using the word addiction and now call it a substance use disorder. Some of that helps remove the stigma of using the words addiction and alcoholism. So when a person has a problem with alcohol that's clinically significant, a clinically significant impairment, we say that they have an alcohol use disorder. And as we talked about before, a substance use disorder occurs when there's a recurrent use of alcohol and or drugs, which causes clinically significant impairment. And this is from the DSM-5, which is the standard classification of mental disorders, which is used for clinical and research, policy, and reimbursement purposes. It's what the folks in the mental health field refer to when making their diagnoses. And what they do is they refer to it as, let me go back one. They've changed the terminology, like I had said, and they now refer to the use of a particular substance, such as alcohol, cocaine, a sedative, opiate, and then they refer to, and then combine that with the severity of the impairment. So for instance, you'll have an alcohol use disorder, which is either there's a mild impairment, a moderate impairment, or a severe impairment. The same holds true for cocaine, opiate, cannabis. There's a number of other drugs too. So that's how it's classified now using the DSM-5. So what do substances do to the brain? That's what we want to now talk about. We talked about the scope of the problem. We've talked about concern for lawyers and the concern for our fellow Americans. So we know that substance use disorder is a chronic disease that changes the brain structure and the function of the brain. I am involved with the Max Planck Institute for Neuroscience here in Palm Beach County up in Jupiter. And the chief research scientist for neuron disorders and I were talking. I told her what I do in terms of helping families. And she said that, she said to me, substance use disorder is a severe neuronal disorder. And that was a few years ago that she had mentioned that to me. And boy, that really helped change my thinking around it from being something that, gosh, why can't this person just stop drinking or stop using drugs? With whatever shame or whatever emotional attachment that we as a society may hang on people who have these problems. This clearly, at least according to this neuroscientist, who's one of the top neuroscience researchers in the country, this clearly is a brain issue. It's a severe neuron disorder. So that helped me in my practice and in viewing clients and in viewing people who have a problem. And so let's talk a little bit about that. Let's talk about what happens to the brain. So we're going to talk about, what is called the pleasure signature. We all experience human pleasures, shopping, the first kiss, holding your lover's hand, a good meal, hearing a baby coo. These all register the same way in the brain. So that's where we're going to go now in terms of what happens to us. So excuse me. So these events trigger a release of the neurotransmitter dopamine into the nucleus accumbens and the ventral tegmental area. Both of these areas of the brain are midbrain, about 2 inches. The nucleus accumbens is about 2 inches behind the eyes. The VTA, the ventral tegmental area, is a little bit below that. But both of these areas of the brain are involved in motivation, reward, and addiction. And so when, the things that normally give us pleasure, like a nice meal, watching your team win a game, winning a case, right? You get a good ruling. These are things that trigger the release of dopamine into the nucleus accumbens and into the ventral tegmental area, and they provide motivation and reward. That's the way evolution has it set up, so that we act in this way on a continuous basis. The problem happens is when there's repeated exposures to substances or behavior, shopping and gambling and retail therapy, as they say. Gambling is a really difficult one. What happens is that the communication between the nucleus accumbens and or the VTA, the ventral tegmental area, and the prefrontal cortex. The prefrontal cortex is the part of the brain that is our executive decision maker. It is the one that says, there's a stop sign, stop the car, hot stove, don't touch. You've worked long enough, go home and rest, or go play some golf or tennis or something. It's the executive decision-making part of the brain that helps us make good decisions for ourselves. So, and that's wired by neuropathways to the motivation and reward part of the brain that we talked about. And so, but when a person is using substances frequently, then that wiring gets changed, it gets altered, so that it moves from liking the substance to actually having to require the substance, to needing the substance. And then what happens somewhat diabolically is that the prefrontal cortex becomes the servant of the dopamine receptors in the nucleus accumbens in the VTA. And so the way that manifests is that you'll hear the person who clearly has a problem minimizing it or being in denial about it. That's the prefrontal cortex operating to be able to protect the dopamine receptors in the nucleus accumbens so that it can continue to get what it wants. And this will happen so much in a person who actually has a significant impairment that the person forgoes eating, they don't sleep, they don't work, and what you see is, they stop parenting, or they parent in a really lousy way. And that's because their brain has been hijacked. You probably remember Bill Moyer's, who was a really good media specialist, with Lyndon Johnson's media person. And he did a series in the 1990s on PBS called The Hijacked Brain, about what happens to the person with the alcoholic or addict back then, and how their brain is hijacked. And what we see on the next couple of slides are courtesy of Dr. John Dyben with the Hanley Center at Origins, who'll be presenting as well on this panel. We see the pathway, the brain reward pathways between the frontal cortex, the nucleus accumbens, and the ventral tegmental area. And then in this next slide, we'll see what happens to in the nucleus accumbens to the dopamine receptors when on the left-hand side, as I'm looking at this, where there's food, there's just a nominal number of dopamine receptors and dopamine present. And then on the right side, when you introduce cocaine into it, you can see what happens in terms of the frequency and the amount of dopamine and dopamine receptors. And so that's kind of the brain on substances, the hijacked brain. All right, let's move on now to what can we do? What can we do to help our clients? So, how do we recognize this issue, and how can we tell clients how to recognize it among their loved ones? Well, obviously, legal consequences, DUI, divorces, committing crimes, hospitalizations, emergency room visits, prior treatment episodes, loss of employment, and the obvious slurring speech, and poor hygiene, inattentiveness to life functions, relationship difficulties. You'll see those in your practice. Occasionally, the individual will say, and I ask my clients who come to see me, has your loved one ever said to you, especially in the morning, gosh, they're hungover, I need to stop this. My life is a mess. Every once in a while they'll say that thing. That's really good evidence that I use in presenting to a judge. Physical signs of use, empty alcohol bottles, drug paraphernalia, more red flags. These are additional red flags that are obvious. Functional decline, including isolation. That happens an awful lot. This is about that singer who her family wanted her to go to rehab, but she said no. So what do we do? And how can we advise these folks who come to us? We know that treatment and recovery works. The science informs us that treatment works, and more treatment works better. That the science is very clear about that. It allows the person with a substance use disorder to rest and recover and learn about their brain, learn about their behavior, learn about their triggers. But most important, it allows abstinence. It requires abstinence. Can't drink or use drugs when you're in treatment, although people try. But it allows abstinence so that the brain can cool down. So that process of the dopamine receptors always demanding more and more, and the wiring between the nucleus accumbens and the prefrontal calms down a little bit. And so then little by slowly, the process of creating new neural pathways occurs, neural pathways that will support long-term recovery so that the simple things in life become valuable again. But you can't do that without abstinence, which is one of the critical parts of treatment, that and tending to the person's medical needs, making sure that they're resting, making sure that they're eating food, healthy nutritional food. So many people who especially older people, who have an alcohol use impairment, they drink, they don't eat. And so their body, gets sicker and sicker. And again, what do we do? Well, the evidence strongly suggests that the highest success rates for treatment and recovery come from a combination of long-term treatment with both internal and external motivating factors. And from the studies that have been done in something called the Principles of Drug Addiction Treatment, and this was done back in the early part of the century, the early 2000s, which created a research-based guide from the National Institute on Drug Abuse. They came up with these principles that remaining in treatment for an adequate period of time is critical for treatment effectiveness. And I'm going to tie in these principles into the Marchman Act because the Marchman Act includes these principles. And the science indicates that the threshold of significant improvement is about 3 months in treatment. We can get a treatment order initially for up to 3 months. Let's see what's next. Substance use disordered individuals who have co-occurring mental disorders should have both disorders treated in an integrated way. The co-occurring mental health disorders that we showed earlier are anxiety and depression, or if you combine those, bipolar, sometimes you have borderline personality. But those need to be addressed at the same time that the substance use is being addressed, because one without the other is not going to, is a recipe for failure and a recipe for the person to use again. Let's see, another one of the principles is that recovery is a long-term process. It frequently requires multiple episodes of treatment. I sit on the board of directors at the Fern House for Men, along with Deputy Chief Mike Gauger of PBSO, and our executive director, Chuck Cordell, he's authorized me to say this, he needed to go to treatment 15 times before he finally got it. And now he's like 20 years clean and sober now. We also know that being involved in self-help support programs, both during and after treatment, are really necessary to maintain abstinence. So what happens when a client tells you that a family member or a loved one or a colleague or a neighbor has a substance use disorder, but they do not want to quit, no matter how much the family has begged and pled with the person, and threatened and cajoled, and if you love me, you'd go to treatment, and that person says, nope, not doing it. So what can you tell this client? Especially given some of you may be familiar with Al-Anon and some other recovery programs and other well-intentioned individuals who strongly suggest, well, you got to kind of let the person hit their own bottom. And the problem that we have with that is that, in 2018, we had 70,000 deaths from drugs, and we had 82,000 alcohol-related deaths. So can we really say that what we ought to do is just let people hit their bottom before they get clean and sober, or do we need to do something else? And so what's suggested is to engage the client, have them engage the family member in a form of rational detachment. So what I recommend to families is that, that what you're seeing is a symptom of an active disease, like if it was cancer or kidney failure or diabetes is frequently used as an example. So you're seeing the symptoms of an active disease, and it's got nothing to do with you. And what you need to ask family member yourself is, what is my duty here? What is it that I should be doing? What active steps can I take to help my loved one? And I can tell you, as a parent who has put a child into treatment, it is not an easy thing to do, but it is doable, and it saves their life. I want to relate a story that I had a couple whose daughter was using heroin and was out on the street doing terrible things. And he was an attorney, and the wife had said, if we Marchman Act her, she may not be able to get into an Ivy League school, or she may never speak to us again. And this guy, this attorney, corporate lawyer, got his eyes welled up, and he said to me and to his wife, that may be true, but I want to know that if I'm standing at her gravesite because this disease has taken my daughter out and taken her life, I want to know that I've tried everything humanly possible to save my daughter's life. And that is as poignant a story as I've ever heard from any of my clients. And so that's a segue then into that we need to intervene legally is what the answer is, using involuntary commitment to treatment. I read David Brooks a couple of years ago. David Brooks is with the New York Times. He's an op-ed columnist. He's a moderate politically. He's not conservative, he's not liberal. But he wrote that the opioid epidemic of a couple of years ago was so severe that we needed a form of benign paternalism to combat it. And that, ladies and gentlemen, is what the Marchman Act does. It's a form of benign paternalism where the state has said, look, you're not making good decisions for yourself. So we as the state have a right to intervene and to help you because you're not helping yourself. So we need to intervene legally. And what's interesting is that, and I didn't know about this until I started doing research a number of years ago when I started this practice, is that there's plenty of science that tells us, that informs us that involuntary commitment to treatment is at least as effective, if not more so, than voluntary commitment to treatment. And that clearly is the science that says, we got to wait, that completely eliminates the argument that no, you should wait for people to hit a bottom. And so there's actual data, there's actual research that has survived scientific scrutiny that indicates that no, that involuntary commitment to treatment is at least as effective, if not more so. And there's studies here that are referenced here. And if you're interested in studies, email me, joe@joeconsidinelaw.com, and I'll be happy to supply you with these studies. So why does involuntary commitment to treatment work? We know, especially among licensed professionals, airline pilots, doctors, nurses, lawyers, they do better in treatment than the general population. Why is that? And a friend of mine in the treatment industry said there's skin in the game. They got skin in the game. The general population doesn't necessarily have skin in the game when they're in treatment on their own. And so what we see is that through the use of this program called the Human Intervention Motivation Study, the HIMSS program, which is set up with the FAA, airline pilots, impaired airline pilots do really well. They have the highest rate of success. It's like above 80%, 90%, which is an amazing statistic. But they have, if they hope to ever get back into a cockpit, they must do this. They must undergo screening and consistently be test negative for any substances, and it's long-term treatment and monitoring. And with this leverage that if you want to keep your job, you're gonna follow this. And we know that it takes at least a couple of years for the neural pathways for neural readjustment to occur, so that the neural pathways between the nucleus accumbens, the reward center, and the addiction center, and the prefrontal cortex takes time for that to happen. So how do we create skin in the game for the general population? People that don't have licenses, people that have not gone to years and years of school and worked hard to get a license, and really have people who are licensed have a very strong motivation. Well, the Marchman Act creates skin in the game. The entry of a court order for assessment first, and then later a second order for treatment, the violation of which, the violation of this civil order, it's a civil order, subjects the individual to contempt and possibly incarceration, thereby creating skin in the game. A little bit of the history is that this is the Hallis-Marchman Alcohol and Other Drug Services Act of 1993. Which addresses the entire array of substance abuse impairment and co-occurring mental health issues. It's not the Baker Act. Hal S. Marchman was a minister up in Volusia County who tended to homeless people and to people who were addicts and alcoholics, and went to the legislature and said, there was the Myers Act back in the 80s and the 90s, early 90s. And Reverend Marchman said, we need something better. We need something that's more effective, both for alcohol and drugs. And hence they named this act after him. So now we're going to refer back to the principles of drug addiction treatment slides that we talked about a number of minutes ago. So the individual who's under a court order, for the time necessary for the brain to begin to heal, because we can get treatment orders for up to 90 days at a time. I've been able to keep people under some type of services order, treatment order, for 12 months. And so we know that the Marchman Act addresses each of the issues that we talked about under the principles of drug addiction. We know that treatment works, and more treatment works better. So why use the Marchman Act? So because we know that court-ordered treatment is effective. You see this in other instances, in criminal matters and dependency matters. But most of the time people aren't involved in that. They're just they're living their lives, and they've got a substance use disorder. They're not involved in a criminal case, or they don't have a DUI. They're not in a family law matter. So we find that getting a court order, we call a nudge from the judge, is very effective. Legal pressure. This is the result of these studies. Legal pressure increases treatment attendance and improves retention. And individuals under legal pressure tend to have better outcomes than those without legal pressure. And again, there's some studies cited there. If you're interested, Joe at joeconsidineLaw.com, I'll send them to you. So one of the things that families ask me about all the time with the Marchman Act is, is this confidential? And yes, it is. The statute is very clear that this is a confidential process, that there can be no disclosure of any of the pleadings that in the case. And in fact, if if you know somebody who has had a Marchman Act, if you go and you go to the clerk's website and type in that person's name, you will not see that there's been a mental health case filed against that person. There is some language in the statute that talks about good cause as a basis for being able to access treatment records. There's no case law that interprets this this provision. What I suggest is that it's just like the in the family law cases with child custody issues, time sharing issues. In that one case where there's where somebody was able to get treatment records of a mother who had tried to commit suicide, I think with the kids in the car or something, during the pendency of a custody litigation, the court found that that was good cause. In my estimation, it would be that level of egregious activity that would give rise to a finding of good cause. So I tell my family members to rest assured that it would be extremely difficult to breach the non-disclosure, and that this is a confidential process. This is an interesting part of the Marchman Act. You do not need to be a Florida resident. You don't need to have any time here. All you need to do is be present in the state for 10 minutes, and we can get a treatment order. And for that reason, interventionists and case managers and families out of state want to they encourage families to bring their loved ones into the state so that they can get a court order requiring them to be in treatment. So as we said before, the Marchman Act addresses both substance use disorder and co-occurring mental health disorder. I've been able to use it when there's really been primary psychiatric issues that don't rise to the level of a Baker Act. Usually these cases with psychiatric disorders, there's some level of self-medicating that's taking place. So they're smoking weed, or they're drinking, or they're using benzodiazepines. And that gives me the entree into the Marchman Act and substance abuse. So the procedure, now we're going to get into the nuts and the bolts. The procedure is phase one is you file a petition for assessment and stabilization. Stabilization is also known as detox. You get an ex parte assessment order. You can, if it's a true emergency, most of these are, with pickup by law enforcement. If it's not an emergency, then the court schedules a hearing on an expedited basis. Once an assessment order is entered, then an assessment is done by a qualified professional. Qualified professional is a Chapter 490 or 491 licensed individual. Phase two is once the assessment is done, then we file a petition for involuntary services. This is the treatment part. So based upon the testimony of the assessing clinician and a fact witness, usually a family member, the court can enter an order for treatment for a period of time not to exceed 90 days initially. The legislative intent is pretty obvious. The statute defines what substance abuse is. It's the use of any substance if that substance is unlawful, or if it's detrimental to the user or others, but it's not unlawful. Substance abuse impairment is defined by the statute. It's a condition involving the use of alcohol or any psychoactive or mood-altering substance in a way to induce mental, emotional, or physical problems and cause socially dysfunctional behavior. So these are just kind of some side notes as we wind down here. We find more and more residential and outpatient treatment programs are including the Marchman Act in their business model because, number one, it gets people who need it into treatment. A lot of times families will call the Hanley Center at Origins or Life Skills or Futures or Beachway or any of these facilities and say that their loved one has a problem, but We can't, how do we help them? How do we get them into treatment? So more and more treatment centers now are recommending that that the Marchman Act is available. Number one. Number two, when somebody is initially voluntarily into treatment but then wants to leave, the Marchman Act can be employed to keep the person in treatment. So again, let's go back to phase one, the involuntary admissions. We're just going to kind of whittle down a little bit. What you've got to show is that a good faith reason to believe, and good faith is in there because every once in a while we get somebody who's going through a divorce or about to go through a divorce and wants to file a petition in the Marchman Act. That sometimes is good faith, but a lot of times that's not good faith. I had a case in Palm Beach involving two brothers whose their mother passed away, leaving an estate, and one of the brothers filed the Marchman Act against the other one because he wanted to get a leg up in the estate proceedings and to be named as the personal representative. We actually had a 2-day trial on that case. So a good faith reason to believe the person is substance abuse impaired or has a co-occurring mental health disorder. And because of that impairment or disorder, they've lost the power of self-control over substance abuse. That's number one. And either 2A or 2B, that they need substance abuse services, but by reason of their impairment, they lack the judgment to realize that, and they don't have the ability to make a rational decision about that, or that they're likely to suffer from neglect or refusal to care for himself, and that poses a real and present threat of harm to their well-being. So it's one, which is that there's a substance abuse impairment, and two, either A or B, because of the impairment, they need services, but they lack the insight, the judgment to get services for themselves, or that they're likely to suffer from neglect or refusal to care for themselves. Those are and that's the burden of proof is a mere preponderance on that. It gets harder as we move into the involuntary treatment, where clear and convincing evidence is required. And who can file a petition? Really, anyone who has, any single adult who has direct personal knowledge of the person's condition can file a petition for a Marchman Act. That's changed in the last couple of years. It used to be 3 unrelated parties or a family member. Yeah, this is always a concern here. Mental health counselors and therapists need to be a little bit wary because of the HIPAA issue and also because of the Florida Evidence Code. And two responses to that. One is that there's a HIPAA exception to non-disclosure, where disclosure is allowed or permitted when necessary to prevent or lessen serious harm to an individual. So that falls under there. So the testimony of the clinician who's done the assessment, in my opinion, I don't know if there's any cases on it yet, but in my opinion, it's an exception to HIPAA. And then the Florida Evidence Code, the exception is there when there's a court order that requiring an assessment, and the clinician can testify under that exception. The court makes a determination either on an ex parte basis or based on a hearing. Excuse me. The order allows the person to be held for up to 5 days for assessment and stabilization. If a petition for involuntary services is filed during that 5-day period, after the assessment is done, but during that 5-day period, the facility can continue to hold the person until there's a hearing on the involuntary petition, the petition for involuntary services. Most assessment petitions result in an ex parte order without a hearing, especially if the petition is drafted carefully enough. And the court can order law enforcement to transport the person to the nearest appropriate licensed provider. Yeah, this is poor Fred. About the involuntary assessment, the assessment has to be reviewed by a physician and signed off. And it has to take place within 72 hours of either the order being issued or admission to treatment. It has to be telefaxed to the court without delay. This is important because we can't get a treatment hearing until this is done. If necessary, the provider can ask the court to extend the time for assessment. Providers making assessments have to define the process that they use to complete the assessment. These are under the regulations set forth by DCF. So these are, in any hearing under the Marchman Act, the individuals, if they cannot afford their own attorney, they're entitled to have an attorney appointed by the court to represent them. I've been called by a lawyer who's a legislator in Illinois who wanted to ask me about the Marchman Act. They were thinking about introducing legislation like that up there, and he said, "How is it that the ACLU hasn't sued you guys down there?" And I said, "Because there's a lot of due process considerations built into the statute, such as notice on all hearings, except on the emergency, the appointment of counsel, notice of all other hearings, the difficult burden of proof, clear and convincing." So anyway, and let's finish up this the assessment and stabilization part. So based upon the involuntary assessment, the person has to either be released, remain voluntarily, or retained if a petition for involuntary treatment has been initiated. So the second, phase 2, is the petition for involuntary treatment. And again, who can file it? The same people who file the petition for involuntary assessment can file the petition for treatment. The contents of the petition are pretty much the same as they are for the contents of the petition for the assessment, except that you have to also indicate the findings and recommendations of the assessment, or that the assessment is forthcoming. The petitioner has the burden of proving by clear and convincing evidence the following, what we call Marchman Act criteria: that A, that the respondent is substance abuse impaired and has a history of lack of compliance with treatment for substance abuse. That part, the lack of compliance with treatment for substance abuse, is I think it's not good policy, and hope to address that with the legislature in an upcoming session. But in any event, and B, because of the impairment, the respondent's unlikely to voluntarily participate in the recommended services, or is unable to determine for him or herself whether the services are necessary. So number one, A, by clear and convincing evidence, the respondent is substance abuse impaired and they have a history of lack of compliance with treatment. And because of the impairment, they're unlikely to voluntarily participate in the recommended services, or is unable to determine for him or herself whether the services are necessary. Now, one of the ways that we prove all of this, let's break this down. Substance abuse impairment, that's proven by factual allegations, the testimony of fact witnesses, the parents, the loved ones, the spouse, and oftentimes the individual who's doing this, who's being assessed, will in the assessment process admit to the clinician that, yes, I've been drinking this amount, I've been using heroin, so a lot of times it's their own statements against interest that get introduced that prove up that the person is substance abuse impaired. The history of lack of compliance with treatment. Treatment can include therapy. So I will make sure to ask parents or loved ones, has your loved one been in therapy to talk about if they haven't been to treatment. Obviously, many times these folks who come to us, they've been in treatment before. It hasn't worked that time, or it's been too short a period of time, 30 days. When we know at a minimum 90 days are required. And then B, the respondent is unlikely to voluntarily participate. Well, if they've left what's called AMA, against medical advice, in the past, that's evidence of being unlikely to voluntarily participate. Or if while they've been in treatment, they've tried to abscond from treatment. The second criteria is that without services, this is similar to the assessment criteria, the respondent is likely to suffer from neglect or refusal to care for themselves. That neglect or refusal poses a real and present threat of substantial harm to their well-being, and that there's substantial likelihood that without services, the respondent will cause bodily harm to himself. At the hearing, the court's going to hear all relevant evidence. Witnesses obviously have to be prepared with firsthand knowledge, not hearsay. The client is to be present, so the respondent, the person with a substance use disorder, is going to be present in court unless it's injurious to that person. And then, as we said before, the burden is clear and convincing. And the court will then either dismiss the petition or order client to an involuntary treatment. Now, the secret in this is making sure the person is assessed by somebody who understands the Marksman Act and who knows what they're doing, because that carries the day most of the time. The clear and convincing evidence standard is met by having a well-credentialed assessing clinician who's taken the time and has reviewed the emergency petition for involuntary assessment, reviewed the allegations. If there's any attaching affidavits, they've reviewed that, and they go into that with the person. And what I do is I spend time training these clinicians on what the court's looking for. And when we get a good assessment, it's kind of a no-brainer as far as being able to meet this burden of proof. The court order that results from that will provide for involuntary treatment by a licensed provider for up to 90 days. The court doesn't get involved with what type of treatment or what level of care. There's various levels of care, from the most intense, which is a residential level of care, down to partial hospitalization, to intensive outpatient, to outpatient, to living in a sober living residence and going to support meetings. All of those things can be ordered by a court under a treatment order. So the court, obviously the court retains jurisdiction, because one of the things that happens is that when the Marksman Act criteria still exist, the petitioner can file a petition to renew involuntary treatment at least 10 days before the end of the 90-day period. And there's going to be a hearing scheduled in short order. And we've got prove up that the individual continues to meet the Marksman Act criteria. And then further petitions for additional 90-day periods can be filed if grounds for involuntary treatment persist. So, of the hundreds of cases that I have filed, probably 50% of them, there's going to be a petition for renewal. Maybe 10% or so of all of the cases filed result in a third petition being filed. And those are the cases typically where there's significant psychiatric issues that are going on too. So initially, the first 3 months, they're trying out different antipsychotic medicines. They're trying to just get the person's psychosis resolved enough so that they can start to address the substance use disorder. Just a quick note about mental health professionals, MHPs. They have not testified in court, and many times they're unafraid. They're afraid because they don't know this. And those of you who've, prepped psychologists and people who've done evaluations, know the importance of preparing your witness. I remind them that they're the only expert in the courtroom, and they're going to testify about whether testimony is limited to whether or not the individual meets the Marchman Act criteria. And I, like any of us do, we prepare the person a couple of days in advance. So, a path forward. Where do we go from here? We know that we have this enormous problem in this country with tens of millions of people who are, infected, afflicted with these terrible substance use disorders. And they interfere with so much of our, what I didn't include in here are the business losses, the productivity losses in the billions and billions of dollars because of substance use disorders. And so many of our fellow Americans have, in addition to the substance use disorder, the co-occurring mental health disorders, the bipolar, the anxiety, the depression, that also has to be addressed. The problem is it's clearly a significant neuron disorder. The brain becomes hijacked by these substances. It requires treatment. It requires a cooling off period so that the neural pathways between the pleasure centers, the motivation and reward centers of the brain to the executive decision maker of the brain cool down and get a chance to have a neural adjustment period. And this happens in treatment. We can't wait for people to hit bottom anymore. We can't afford to do that. As David Brooks indicated, we need a benign form of paternalism. We've had, all these deaths in 2018. I don't know what the statistics are yet for 2019. These folks' prefrontal cortices are not working. We need to use, I tell my family members that you need to use your prefrontal cortex and ignore everything that the person is telling you about why they don't need this, because you're being lied to. Their hijacked brain is lying to you. And I tell the story of that lawyer who said that he wants to know if the disease takes his daughter out, that if he's standing at her gravesite, that he did everything humanly possible to save her life. And then finally, we know that by the science, and this helps parents a lot, this helps loved ones who have to pull the trigger on this, on filing this Marchman Act, in effect forcing their loved one into treatment, that involuntary treatment is at least as effective, if not more so, than voluntary treatment. The science is there, it's plain. And then lastly, we know that the Marchman Act is an effective tool to get people with substance use disorders the help that they need to recover. So again, here's my name and number, and if I can ever be of help to y'all, if you ever have any questions about this, I write extensively about it. Go to my website, Joe Considine Law. There's a lot of articles that I've written in there. I just again want to thank Eddie, and I want to congratulate him and the panel for the work that they've done in this, and hope that you all stay safe during this very difficult time that we're having, and wish you all the best. Well, thanks for listening to that. And now we want to segue right into the two fine professionals at the Hanley Center at Origins, Dr. John Dyben and Deborah Kuzmin. So take it away, folks.
Hi, everybody. My name is John Dyben. I'm the Chief Clinical Officer for Origins Behavioral Healthcare.
And I'm Deborah Kuzmin. I'm the Vice President of Clinical Services for Origins Healthcare.
So between Deb and I, we've got over probably 40 years of experience in this field and working with patients and in mental health and in addiction specifically. And so today we really want to talk about, we want to have a conversation that will answer three really important questions that your clients have, that our patients have, that family members have. One, we want to talk about how do I best care for my loved one who's in the throes of addiction? What are some do's and don'ts? How do I be responsible and be helpful and be loving and also be healthy? So that first question is, how do I care for a loved one who's in the throes of addiction? The second question is one that's even harder in my experience, and I don't know if you would say the same, but how do I help the child who has an adult parent who is in the throes of addiction? How do I help that 5-year-old, 10-year-old, 15-year-old? What do we say to them? How do we deal with this? So we want to answer that second question. How do we properly and in a healthy way care for children whose parents are in the throes of addiction? And then finally, the last is, how do I care for myself when my loved one is in the throes of addiction? And all three of those, especially if you're working with families, are critically important to understand what to do. So those are the three questions that we want to answer. Let's start with that first one, Deb.
Yeah, okay.
So how do I care for my loved one when they're in the throes of addictions? What are some things I need to do and not to do?
Yeah. Well, as you're aware, and I'm sure everyone's aware who's watching this, when you meet someone who's telling you that they're in the throes of this, everything is chaotic.
Right.
I mean, the world is larger than life in those moments because they're in crisis.
Right.
So when someone's loved one is struggling, or child or wife or husband is struggling, their whole world becomes a struggle too. So the little things that maybe at one point could be manageable become completely unmanageable. And this, I guess the simplest response would be to get help. I mean, you can't do it alone because our thinking is sort of skewed.
Right. It's so interesting. Whenever I ask, how do I deal with something, I want the answer to be, this is how you deal with it yourself.
Here's your manual.
Right.
Fix it.
So what I hear you saying is the very first and foremost is you got to get help. And it makes sense. I mean,
it's so crucial, right? I mean, you need someone who can be objective.
Right.
Who can actually have the foresight and the insight, because in that moment it's okay to accept that you just don't.
Right. And you're dealing with a disease.
Right.
You guys probably had an opportunity to hear from Joe Considine earlier talking about what we mean when we say that addiction is a disease. But a disease requires professional treatment. It's a disease of the brain. And so I think you're right on. What would that look like? So when you talk about professional support, who are we talking about?
Yeah, that's a great question because there's lots of professionals and probably lots of people who they've tried. I mean, you might talk to someone who said, I've gone to a professional. It didn't help. It didn't work.
Right.
And so it's like any other specialty, a professional who has experience with that specific expertise. So, I've heard you say many times, if you have a heart condition, you should probably see a cardiologist.
Right, exactly.
So, I mean, if you have a loved one struggling from addiction, and like you said, the disease of addiction, which I would add is a family disease now, you need someone who has expertise in working with a family solution for addiction.
So, doesn't every doctor know all about addiction? They're doctors, right?
Yeah, it would be nice to be able to answer yes to that, but very limited oftentimes, right? I mean, we've worked with many medical professionals, wonderful, well-meaning, with good insight into their specific expertise, but will often make recommendations or suggestions when it comes to the addictive disorders or addictive diseases that are not necessarily in line with the most current information, right?
Yep.
What's been your experience with?
Exactly the same. And it's a common misconception out there, this idea that if someone is a doctor or a psychologist or a licensed clinical social worker or a mental health counselor or a marriage and family therapist, that they automatically understand addiction. And attorneys will certainly understand that, everybody thinks that you've all had experiences, right, where someone has come to you, maybe your expertise is criminal law, and someone really wants you to tell them what to do about their divorce, and trying to explain to them that family law and criminal law can be very different. People think lawyer means you know everything about the law. So when it comes to medical and mental health professionals, it's important that you seek out and that we help people seek out physicians who are ASAM or ABAM, that's the American Society of Addiction Medicine, the American Board of Addiction Medicine, that they're ABAM or ASAM certified, that if you're looking for a psychiatrist, that it's an addiction psychiatrist, that they're certified in addiction medicine. When you're looking at therapists and clinical social workers, it's really important that they have a history of working, a significant history of working with addiction as well, because even, like you said, the most well-meaning people can end up kind of putting you in the wrong direction.
Just from naivete.
So that's the first thing, and is getting that professional help. There's another thing I hear people say. They say they support the health and the recovery of the person, but don't support the disease.
Boy, this one is a tricky one, right?
Yeah, what does that mean?
How do you decipher the difference between those two?
Mm-hmm.
It's a tough one. It's really a tough one because again, let's go back to that moment of crisis. Everything is confusing. Everything's sort of mixed up and jumbled together. So what does supporting health versus supporting the disease even really mean? And I think, I can tell you in my experience that oftentimes I see people engage unknowingly in quite the opposite. So when your loved one comes forth and says, I'm ready, I need help, and they get into treatment, it's often that time that you might be seeing people say, I'm ready to get divorced. I'm ready to, and I wonder, in that moment, is that the right time? Maybe, maybe not.
Right.
But also the same would go if someone's continuing to struggle with active use. Is that the time to be maybe accessing drugs or alcohol for them to make sure they're safe, or to, sort of clear the way from the disasters that are happening around them and start cleaning those messes up? I'm not sure that's the best time or thoughtfulness around that.
So I can think of parents who I've had with, either young adult children or adolescents, and they would, their kids became addicted to drugs, and so what they would do is they would go buy the drugs for their kids with the rationale, hey, if I don't go do it, they have this addiction, and it's going to drive them out to the streets. To
a dangerous place. At least I could watch them or have them safe in my house. How many times have we heard that?
A lot.
Yeah.
And so one of the, it kind of, parents especially, that's kind of our instinct. Even though it's not about, the people that have done that aren't bad parents.
No. Actually, their intention is quite really loving.
Yeah.
I'm going to keep them safe because I'll watch them.
Yeah.
I'll stay up night and day to watch them.
Unfortunately, what ends up happening is anything that we do to make the disease easier to progress, that we call it supporting the disease. And again, it's not something that's done by bad people. It's done by a place where people are just trying to do their best. And so what we want people to know is that your mantra has to be, I will support your recovery, but not your disease. So what does that mean? That means that I'm not going to give you rides downtown to pick up drugs, but I will give you a ride to a meeting. I will help you get into treatment. I will help you access support. I'm not going to help you access alcohol and other drugs. Now, it is critical, though, that we do note one caveat, right?
Right, important one.
It is an important one. So when your loved one has, and part of their addiction is central nervous system depressants. So that's things like alcohol, benzodiazepines, Xanax, Valium, or barbiturates, anything that's a central nervous system depressant. We actually, when we talk to patients and they're coming into treatment, we actually want them to continue to use all the way in the door. So if you've got a patient who's on an airplane and we're picking them up, or a treatment center or a program is picking them up at the airport, it's all right, let them drink. And in fact, we want them to continue to use those all the way up until they get to where we have medical professionals that can work with them, because otherwise they do run the risk of going into withdrawal, and that can look like seizures, and it can be very, very dangerous. So that's the caveat.
Yeah. There's sometimes people don't know this information. That's why I think having someone who's really expert in addictive disorders. I mean, there really are a couple drugs that are fatal upon withdrawal,
Right.
not just intoxication. And
Right.
oftentimes people aren't aware of that. And what Dr. Dyben was mentioning with alcohol and benzodiazepines, those central nervous systems, those are the couple that actually, if you go into withdrawal, can be fatal.
Right.
So we really highly recommend that people not be cold turkey stopping those, or stop them without a medical professional
Right.
who can support and oversee the withdrawal management piece.
Absolutely.
You know, as you were speaking before, it reminded me of this story. Everything reminds me of a story.
Tell me.
So I was in another state and was meeting this family, a mother and a grandmother, who were really worried about their, 17, 18-year-old son and grandson. And they were in my office and really saying, I just feel so hopeless and powerless. I can't stop him from going to these places because he has his own car, he has his own wallet, he has his own keys. What can I do? And that's where I had this aha moment where I thought, they really are feeling powerless,
Right.
and needed a little reminder. Who pays for the car?
Right.
Well, Mom said, I do. And who pays for the insurance? I do. You may have some more power than you think you do,
That's
because
right.
it's really your car.
That's right.
And it was like their lights just went on. Oh, I have the right to take away my own vehicle from someone who's using it to cause harm, to could be deadly. And so sometimes that's where that combination of how do we support healthy
Yes.
sobriety and healthy, and also having that support in your own life to be able to point out things that would seem obvious potentially if you weren't in a crisis.
Right.
But because you're in a crisis, it felt to them like, what am I going to do? He can just drive off.
And that's why it's hard in the midst of it to get it. We can sit here, and some people, maybe you can listen to the story and say, well, of course they should have known that. But the reality is, when you're in the midst of
And
it.
good meaning and sought out services because
Right.
they didn't know what else to do.
Right.
But, they really needed an objective view.
To be able to see what it means for them to support recovery as
Yes.
opposed to supporting the disease, and letting him continue to have the car with supporting the disease.
Without any consequence.
Yeah.
You know.
Yeah. It makes me think of, people, I've always heard this term tough love, right? And, it's an interesting thing. People will say it all the time. You got to have tough love. And what that, in my mind, when I ask people, what does that mean? And try to get them to explain what they mean.
Yeah.
They sort of mean, like, look, if my loved one isn't doing what I want, I'm just going to, I'm rejecting you, and you're
Okay,
done,
right,
and
right.
we're done with you. And is that is that a healthy way to be? Is that
Yeah, it's funny you ask the question in that way, because if you think about any other disease, because we've all gotten to the same agreement
Right.
here that we're talking about it, a disease. Addiction is a disease. And so if you came to me and asked me the same question about someone who's struggling with cancer, for example, and they're really, struggling with some relapse into having active symptoms of having cancer, would we ever tell someone to use tough love and to, if you don't do it this way, my way, I'm not going to support you going back into the hospital, or I won't take care of the kids, I'm too tired, I can't do this anymore?
right?
Probably not. We'd probably say, please go back in and start treatment again. It's okay. I know it's going to be a lot, but I'll take care of the kids, or I'll take care of the property, or whatever it is. We would gladly walk there. And sometimes we struggle with that in the addictive diseases, right? The addiction is a disease.
But people don't ask for cancer. They ask for addiction.
Have you met someone who asked for addiction? Tell me more about that.
Do you ever heard that, though? I mean,
almost daily.
Right? We hear that a lot.
Yeah.
When we talk about diseases, people, this idea that people ask for addiction. And the truth is, most chronic illnesses, including addiction, most chronic illnesses have a behavioral component.
100%.
My mother's a type 2 diabetic, and when the doctor diagnosed her, she was very clear with my mom that had you had good diet and exercise and taken care of yourself, you probably wouldn't have developed this diabetes. We talk about, I remember hearing a man talk about his mother who had cancer, and it was the same thing. And he said, look, she smoked 3 packs a day for 40 years, There's a behavioral component, but his mother, we would never, ever say to his mother, well, you chose cancer. We would never say to my mom, well, you chose diabetes. And in the same way, no, to answer your question, I have never met a person with the disease of addiction that sought out to become addicted.
Right. And we certainly know, and I'm sure that Joe Considine, previous to our talking today, has done a nice overview of what the brain really looks like when it's hijacked, and when there really is no choice in the matter, when you've lost the ability to choose, that the brain is in a place where it's activated and all bets are off.
Right.
And so, in those moments, we talk about tough love. And I'm not sure that really fits the model of what we're talking about when your brain is hijacked and you have lost the ability to choose that. So it brings me back to this wonderful couple who did some trainings that I attended, and one of the statements was, even back at the beginning of the onset of AA, the development of AA, that Bill and Bob would have never met had it not been for their 2 wives. Kind of getting them into the same space.
Right.
And that was just a touching moment to me, because, for those of us who are in this field, really there supporting and facilitating people getting well, we all kind of take on more of the effort. We all work harder than that person in the moment.
Yeah.
And that's the expectation, because their brain's hijacked. All bets are off. And so we're really there until their brain sort of does settle more. And that doesn't look like tough love. It might be coming face to face.
Yeah.
It might be very honest in the way we talk to people and the way we bring up or raise awareness.
Right.
But it's certainly, I wouldn't consider tough love. How would you describe the difference between coming face to face and that space that we live in, without it being that I'm going to cut you off or that
so
kind?
For me, tough love says, I love you if. And I am here for you if.
Big exceptions, right?
Yeah, and healthy love has good boundaries. We'll talk about boundaries in a bit, but has important boundaries. But what it says is, no matter what, I love you. I am your father, your brother, your sister, your husband, your whatever. And I will not do anything that will help progress this disease. And holding both of those truths, I think we probably need to talk about that a little more. What does that look like? How do you do that? How do you say, first of all, recognize that it's not I love you if. It's my love for you, my concern for you, it is here. And I'm not going to do anything that will help this disease kill you.
And that can get pretty tricky, right, at the end stages of addiction. And holding that reality is like walking a tightrope.
Right.
Because you may need to make really difficult choices that feel like cutting someone off.
Right.
But in the moment, it really is, I cannot continue to support these behaviors, and I love you enough to hold the line. I love you that much that I'm willing for you to be mad at me. I'm willing for you to say you hate me. But still do what is right to not continue the disease progression.
Deb, you and I both have teenagers.
Yes, we do. We actually have lots of them.
We have lots of kids between us. Some of you watching this have got kids. Some of us have been parents who've heard those words. I hate you. Some of us have been spouses, or even I know many people. We work with an older adult population also that can. The addiction in older adults has that same thing, all the same problems as with young people, and so we've heard adult children who've had their parents say to them, "I hate you. You're torturing me. You're by not supporting my addiction, you're hurting me." And it doesn't matter if that's your kid saying it to you, if it's your spouse, if it's your friend, if it's your parent. It's painful. And so I think that's a really important message, that we have to be ready. If you want to know how to really care for a loved one who's in the throes of addiction, one of the things that you have to do is prepare yourself to hear, I hate you, you're not my whatever. And know that is the disease talking. And I can't tell you, I can't even imagine how many people we have experienced who have come in saying, I hate my family, they're awful. and left in with the beginnings of recovery with a completely different perspective.
Yeah, those are the beautiful.
So, can we pivot a little bit?
Sure.
And let's talk about how do I care for children when their parents are in the throes of addiction, when they're in treatment.
Yes.
I started working in residential treatment about 18 years ago, and that question would come up. People would come to me, patients would come, and they would say, hey, man, I've got kids at home and I don't know what to tell them, and should I tell them that I'm in treatment? And I remember not really knowing what to say 18 years ago. I would say without a doubt that there is an absolutely clear answer to whether or not you should talk to kids about this.
Yes.
Would you agree?
Yes.
Yes and yes.
Yes and yes.
One thing,
Yeah.
Absolutely kids need to talk about this.
Yeah. Because if you don't, what happens? And what have you seen? Because we've seen it go both ways, where in the best meaning place, a parent who's in treatment decides, I will tell them nothing, and then so to protect them, because I don't want them to worry, I don't want them to be hurt, I don't want them to be scared, so I'm just going to say I'm off on a vacation or I'm resting up. What have you seen?
Two things. One is whether we believe it or not, no matter how well we think we hide it, kids sense when something is wrong. They feel it. They know something is wrong. And the second thing is when they feel something is wrong, and they can't put a name to it, they will always turn it on themselves.
Yes.
They will, if kids are in a home and they know something's wrong and they say, Dad, brother, sister, big brother, big sister, what's wrong? And they're like, no, nothing's wrong. The kids will always internalize it. They will always blame themselves. They will always make something that is scarier than what's really there. And so talking to kids is critically important.
I agree. I couldn't agree more. I mean, I think developmentally, where they are, it is a very still self-focused development. I mean, before that frontal lobe is fully formed and developed, and have that, their narrative at that point is it has to do with me.
Right.
So, and that quickly goes to, I must have done something wrong, to I am wrong.
Right.
So I have caused something to happen here. I'm not sure what it is. And so they really will put a language to it. They will put names to it. And often, I would say more often than not, it's far worse.
Yes.
Because they're self-accusing, or they have said, I've caused this. If I didn't do this, if I didn't get a bad grade on that paper, if I didn't talk back that day, if I didn't wish that my mom or dad or my brother or sister would stop being like this, or would behave or look different, then they wouldn't be gone. So we've just heard, and it really is quite devastating to see children be left in the dark and then create these really scary, sad scenarios for themselves.
I couldn't agree more. I think that one of the really critical things that we have to hear is that children should certainly be, in as developmentally appropriate a way, should understand what is going on. And it's okay for kids, and in fact, kids will always know that something's difficult in the house. Kids know. It's important for us to give language to it so that they don't internalize it. We talked about getting, professional help for, the loved one who has this disease. Is there any need to do that with kids?
Oh, for sure. I mean, we've got such a great resource now of information and support and experience and knowledge about how to facilitate those kinds of environments for children.
Right.
I mean, we have Alateen. We have programs, there's support groups, there's children psychologists and psychiatrists and social workers and therapists who have worked with play therapy and psychodrama, and really, really wonderful interventions to work with children, because there is this continuum of development in which you engage differently. But yeah, I mean, reach out for that support. Figure out where those supports lie so that you can get your child linked in. And we've seen miraculous. I mean, our kids can be so resilient. They're some of the most loving and forgiving in the lives of those of us who have struggled or have seen people struggle with addiction. They're often the first ones that will say, I just want you to be well. And
Right.
it's just, and then it allows this, breathtaking moment for the parent to keep going forward. I'm going to get well.
Exactly.
Instead of I have to get back. So
Exactly.
It's a really wonderful thing to see when they have the right support and the right language and the right narrative around what's happening to them.
And if people are, I always think, because again, having that expertise and having that understanding of addiction and those addiction dynamics is important. I encourage people to, if you have loved ones in treatment and their kids, you're trying to figure out how to get the kids the right help. If they don't have a therapist or therapeutic support, I encourage you to talk to the treatment center, talk to the provider and say, who do you know in my area that does this kind of work?
Right.
I don't know if that makes sense to you.
Absolutely. And to be able to give voice to, it's okay to say, someone who has experience.
Yes.
I mean, I've had very well-meaning providers in the community, colleagues who I've worked with, who have stayed in touch with me for many years and have written and said, do you know where I can get support for my friend whose child is now dealing with a parent? Oof. So not everyone knows.
Right.
You may have you found a wonderful mental health clinician
right.
or a wonderful provider, but because this is such an area of expertise, you really need to have someone who has some language and experience around working with children affected by adults who struggle with substance use or loved ones who struggle
right.
with substance use.
I agree completely. So professional help is again important, and other supports as well.
Right.
Talking to the kids about what's going on. There's a third one that's really, really important to me, and it's super critical, and it sometimes is hard. Yeah. I think it has to be said that we should never, ever, 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 ever disparage a parent to a child.
Right. Ever.
And there are plenty of people out there that will, some people, certainly if we've got family attorneys out there, they're really well aware of the damage that happens. But there are so many people out there that aren't aware of this damage. And in fact, people with great intentions will say, you should tell that kid the truth. They need to understand what your wife has put you through or what your husband has put you through. They need to understand your burdens and what you're going through. No, they don't. Not only do they not need to, but they can't. They can't. And so when a person disparages a child's parent to that child, when they speak negatively about it, even in tone, even in the words, it's not even always the words. It can just be that tone. You're telling the child that a part of them, you're disparaging a part of that kid. And that kid may never say that. That kid will never even necessarily register it enough to have the words for it, but they will feel the shame of it. And so I cannot say enough in every circumstance the kids, though they need to understand that parents have an illness and they're getting treated for it and they're getting help, they don't need to know and that son of a gun stole from us and all of these other things. Right. When somebody disparages a child's parent to that child, all they do is hurt the child. Right. And again, I know there's lots of attorneys watching this. You family lawyers, you see it, you know it, you understand it. Right. But there's a lot of people out there that don't.
And it's hard. I mean, it's the loved one is angry and hurt and in crisis themselves and have had a lot of stuff happen to them. So it's really hard to swallow that in the moment. But you've said it best in that as soon as a child hears the disparaging part, they're hearing you say you.
That's right.
I mean, they're internalizing it. Just like the developmental phase of where they automatically assume the story is about them, that they've done something. When speaking about a parent in that light, always, they're also saying, that's about me.
Right.
That I share that piece with mom, so that's how you see me as well.
Right.
And it's just a part of the development. And I think we've both seen the good and bad. So when it doesn't happen, we've seen kids be able to really gain a level of trust.
Yes.
And support from that parent, and really, that becomes like their inner voice and guiding light to behave similarly. And we've seen it go the other way too, where it's just devastating to watch them shrink and kind of subdue all those feelings because they now are unsafe to speak.
When we don't talk to kids and when we disparage parents to kids, kids feel more and more alone.
Yeah.
They feel more isolated,
Confused.
So all of those things. So that's some really important things. The three main takeaways I got from this is first of all, make sure that there is professional help. That this is, if your kid was struggling in math, right, navigating a new kind of math,
quick to go.
We get a tutor.
We get a
right?
tutor.
Same thing, and that tutor would be someone who understands that.
Who knows a little math.
That's right. Same thing with this. Our kids are they're navigating someplace where they've never been before. We haven't been before, and so getting help from those who have and have expertise is really important. Yeah. Talking to the kids and it is. There's enough shame around this that we don't have to feed the shame by saying, yes, we can't talk about it. Talking openly about it. And then finally, never, ever, ever, ever disparaging a parent to a child.
I love that you brought up the word shame. And I'll just piggyback a little bit on that, because substance use conditions and mental health conditions are very shame-inducing conditions. So with a child too, when you have all that shame and judgment and the stigma around that, when we don't allow for them to speak the truth, hear the truth, and have that safe space, that shame takes on a whole nother life. And instead, they begin to internalize that that something's wrong with me. That's what shame really means. I'm wrong. And so I think that's where the parents are filled with and the loved ones who are struggling, and we translate that and almost give that onto a child if we don't do this the right way.
Right on.
Yeah. And for some of you out there, you might be thinking, I talked to the person I'm representing about getting help, and they didn't want to do it because they can't imagine their 7 or 8-year-old sitting and having a therapist like us to sit in front of and talk to. And I'll just remind folks that there's so many different art forms of therapy, and I've seen really wonderful therapists having kids act out scenes and be enlightened by kind of playing a role out and doing that. And even from the video clips that we've seen come out from Sesame Street with how to talk about, there's so many different levels of ways to give people support and even information. So it's not just this one way talking and sitting in a chair that we get to really.
So another thing with kids is the there is a lot of trauma that happens a lot of times when there is, first of all, divorce is in and of itself a huge trauma, but if you have a parent who is struggling with addiction, that can be very traumatic. Why is it important to worry about that? Why is it important to be concerned about the effects of trauma on kids?
Your questions are really important ones, John, and I think they're very aligned with a lot of the research and studies that we know, particularly the Adverse Childhood Experience Study. And exactly what you said it's a really important research to look into. That's the ACE study, because what it really looks at is that there are childhood traumas, and you named it: separation, divorce, exposure to a substance-using parent. And the study really, in a nutshell, says the more times that you're exposed, the cumulative factor really relates and directly correlates to the amount of struggle that people have decades later in their life. And not just struggles, we see it every day, where we have folks who are in treatment with us, adults, who can report back and say, this is what happened to me as a child. This is what I saw. I had an addicted parent I lived with. I had abuse, sexual and physical, and also separation. All of these accumulated, and here we're working with that individual now. So think about the children of the folks that we're working with, and the individuals that you would be experiencing. So if we could intervene right there with these children in a trauma-informed way, where it becomes not punitive. Many programs and many schools have adopted this trauma-informed care. And so what we've seen as an outcome is that we teach kids how to manage the stress. We educate them about their environment. And that really has the opposite effect decades later. They're much more able to manage. Because without that, what we're seeing is an increase in cancer, in heart disease, in emphysema, in severe obesity, in suicide attempts, in their own substance-using behavior, gambling. So there's a direct correlation of the more exposures, negative childhood exposures that you've had, dose specifically, affects your own life and outcome even decades later.
And not just your mental health, but your physical health and
yeah.
and your emotional and spiritual health, all of it.
Yeah, and even unfortunately, death at a younger age. So this is
Wow.
this is no small feat. The idea of us being able to intervene and know that you need to have intervention. It's not just going to go away.
Right.
Even not just go away by the removal of the spouse or loved one or parent who might be substance using. That's not enough. You need more. They absolutely need intervention.
There's this great lie that our culture that we talk about, and it's funny. I can start it, and anybody can finish it. You know, time heals
all wounds.
All wounds, right? It's something that you know all of our grandparents told us. Time heals all wounds, and it's one of the greatest myths of our culture. Because if you think about any wound, a physical wound, a psychological wound, an emotional wound. You know, I think of a time when I was working construction to get through college, and I got this terrible gash on my leg. And we were out at this old construction site, and it dusty, and it was in the middle of nowhere and dirty, and I just kind of tried to keep working and ignore it because I didn't have time to deal with it. And by the time I eventually had to get somewhere to get it taken care of, it'd been hours that I'd been on this job site with this nasty, dirty, festering wound. And you know, my question is always, if I had just continued to ignore that,
Right.
would time have magically made it better? The reality is,
It would have made it much farther worse.
it would have made it worse.
Yeah.
And emotional and psychological wounds are the same way. Sometimes we believe this myth that because something happened a long time ago, it is somehow magically healed. And the reality is that a lot of us are walking around decade after decade after decade with these open, festering, emotional wounds.
Infected wounds.
And they're making us sick. And so if we can find the kids and we can intervene on kids when they're young, when they're having those experiences, and say, it's not just let's stop you from continuing to be injured, but let's actually treat the wounds that you've sustained. We can help to really change the entire course of their life.
Yes, and it may in fact be painful, and we're all bearing witness to the pain that the children are experiencing when we actually sit with them.
Right.
But in effect, we are clearing out that wound. We are scooping it out and really irrigating it and letting people be able to heal.
Right. The last thing is reassurance, providing security and providing stability wherever we can when kids are struggling because their parent is struggling with addiction. Reassurance, stability, and security. And I want to say that, again, I think sometimes, right, I have this thing where I think that it means having all the answers. You know, reassuring means that I have all the answers. And I remember a lesson I learned with my daughter, when my oldest daughter, Selah, when she was like 7.5. And she would get scared at night because it was raining or whatever. And she called me, and I came in her room, and she says, "Daddy, I'm just scared, right? I'm scared that robbers are going to come get us." Robbers, that's the big thing when you're a 7.5-year-old girl, I guess. And I said, "Selah, don't you worry. Your dad is the biggest, toughest, baddest dude, and if anybody came to get you, I would karate chop them in the head," right? So I gave her an answer to fix the problem.
It's perfect sense.
Yes. And she's like, "Okay." And she says, "Yeah, but you snore really loud, and sometimes you don't wake up. So what if you don't wake up?" So I'm thinking about it. So I got to give her an answer.
New
right?
answer.
New answer.
Quick.
Said, there's great big angels all around our apartment, and they have big swords, and if any bad guy tried to come in, God would tell the angel to get them. And so the angels, all of God's kids have angels around them.
And they don't snore.
And they don't snore, they don't sleep. They're awake all the time. And so again, here I am trying to find that. And I think a lot of us, we try to find those answers for kids, or we feel we have to. My Zayla says to me, yeah, Dad, but what about when angels miss? And I said, what do you mean? She says, like, what about when kids do get kidnapped? Or when all those kids died in that tsunami, right?
So you had a thinking child.
I did. So there she's like, all those kids some of them must have had angels, so angels must miss sometimes. Mm-hmm. And what I realized at that moment is that reassurance is not about having all the answers. So I shut up, and I laid down with my daughter, and I held her, and I just said, I'm here, and I'm here with you. And sometimes reassurance is when we're in crisis, with kids especially, our heart is to give them all the answers, is to fix everything. And as a father and a therapist, as a mom and a therapist, I think we can both say without any question that you will never have all the answers, and especially when you're in crisis. So reassurance and security is about saying, I'm here with you. We're going through this together, and we'll be okay together, because there's no way you'll find or ever have all the answers, and that's okay.
This question about, how do I care for myself
Right.
when someone's struggling? How come we see so many people put that one last?
The idea of, take your own oxygen first, right, so that you can help those around you. Isn't it funny that when we talk about how do I take care of myself, even the very rationales that we have to use to get us pumped up to take care of ourselves is so that we can take care of others, or
Right.
so that...
Right. There has to be another reason why.
Absolutely.
It can't just be that it's okay for you to be okay.
I did an exercise, and it just kind of came to me. I haven't told you this, so we're all learning it together. And I asked a group of people to engage in something, and I did too. And what I asked them to do is to say to another person, you have worth and value simply because you are alive. And everybody could do it. And now I asked them to say these words, I have worth and value simply because I am alive. And that, without exception, was much harder.
Much more difficult.
Yeah. And so it is something for us to begin to look at. And what we want to say is that the rationale for taking care of yourself is more than just so that you can take care of others. It is because you have worth and value simply because you are alive. And
I think that maybe you've had this experience too after working for so many years with families who struggle with someone or many or multiple people with substance use conditions or mental health conditions, that their brain becomes so prepped and prone to care for everything around us and make sure nothing's falling. And I have this visual of the person who holds the plates.
The plates that are
from
spinning.
Anywhere you can stand, we're holding something.
Yeah.
And and it almost becomes like a crisis state.
Yeah.
And so to say to someone, you deserve to rest and be whole and be safe, you can almost, can you visualize?
Feel it. Yes.
I've had people who actually, their expression says,
I haven't earned that.
What does that even look like?
Right.
How would I even accomplish that?
Right.
And so, I think to start with the conversation about you deserve it.
Yeah.
And and here's the kicker. If you are okay and you're feeling safe and you're feeling okay, it doesn't mean you love your loved one less. It doesn't mean that you have to stop loving someone just because right now it's time for you to need to be safe.
Wow.
I can remember another story of an individual who was given that same feedback. Hey, you remember that you don't have to stop loving the person in your life. You don't have to stop loving them just to not live with them. You can actually have them not live with you anymore, and you can still love them.
Wow.
And I remember the person's reaction was, oh, that's right.
Revelation, right?
I can
Yeah.
actually take care of myself and be safe in my own home, keep my children safe in my own home, and that doesn't mean I'm not going to love you. It
Right.
just means I can't have you live here right now.
Right.
And there's so many different ways that we could apply that to safety and to wholeness when someone's trying to take care of themselves when they have a loved one who's struggling.
So that picture of the person spinning those plates, I mean, I think, that's what it feels like when we see loved ones who are, especially spouses, and who are dealing with their loved ones who are addicted, or even parents, right?
And children.
All the
Children
time.
taking care of adult families.
We
they're
see
managing
it.
their homes and their
Yep.
finances
Right.
and their treatment, and
Right.
just a lot.
So let's break it down. So that person, I'm that person. What would you say, this person needs to, how does the person who has loved one or loved ones in the throes of addiction, what would be the first thing that you would say to them for, how can they begin to care for themselves?
Well, I guess it falls in line with what we've been talking about all the way through, is you deserve first to have someone in your life who's there to support you. You deserve that too. You deserve to have a voice. You deserve to be listened to have, that time each week for some supportive person who helps you think objectively. You deserve that too. I have heard more people say, it's sort of unfair. They get to get well and have a break and go to treatment and start looking at themselves, and I'm stuck managing all my plates that I'm holding.
Right.
I'm feeling as crisis-oriented as always. That's right.
Right.
You also deserve to find ways to put down some of those plates.
So getting that support, whether it's the support of, again, a
you
therapist,
get to heal too. Exactly.
Al-Anon,
Yeah,
support
absolutely.
groups, and even this is a place where even a clergy who have really good understanding of addiction, and both professionals and paraprofessionals and non-professionals can really help. It's about finding people who've been on that journey for a while that
Right.
you're just beginning. I think
And that community, right?
That's
having
it.
a community around
That's it.
you. So it's the epitome of the family disease. Everyone is going to need a community of recovery now.
Right.
The children will need that.
Right.
You will need that. Your loved one will need that. And then it kind of has this real nice bond of connection. And I think a lot of addiction, what it does is it separates us from feeling connected.
Absolutely.
Right? And so I think it's fair to say the whole family deserves to begin to tie into connection and
Right.
meaning to one another.
And that's connecting to each other, connecting to themselves, and connecting to all of life, connecting to everything.
Right.
And being part of whether you're the person with the actual physical addiction or you're part of that symptom, you get disconnected from everything.
Right. Sometimes I think that connection might even be to a larger, different purpose in the moment. I mean, for so many people, the purpose of life becomes keeping you alive, keeping
Right.
my loved one or
Right.
my significant other or my parent, keeping them alive because of the substance use severity. And so when that stops, when they might even be able to get them into some support or into recovery, this idea of now I get to consider a connection to a larger purpose for myself.
Yeah.
And that's not selfish.
Right.
And that's part of caring for oneself.
And knowing that can also sometimes cause a crisis.
I think it often does, right?
Right, we see it. So it is, and people, if they know that this might happen, it's so helpful. So
I've seen a lot of people, heard a lot of people say, when my loved one started to get better, I took a look in the mirror and noticed I don't feel any better. Aren't I supposed to start feeling better if they are?
Yeah.
Why am I not? That's a pretty good indication that you deserve your own support, and that something is needing to be tuned into at this point.
And helping people see that and know that that's okay, know
Right.
that that's a normal.
It's
They're
pretty
not
normal.
crazy.
Yeah, exactly.
Things that people ask and the questions is people talk a lot about boundaries, and we talk about setting boundaries, and we talk about the importance of setting boundaries and taking care of ourselves. One of the things I think people get confused when they hear about boundaries, and it's kind of like, okay, I'm going to set some boundaries with Deb.
Yes.
Deb, you cannot do this, and you can't do that, and you must do this, and right. And sometimes that's what we think about when we think about setting boundaries. When in taking care of yourself, it's important that you only set boundaries for yourself. When we try to set boundaries for others, it's always going to fail because we can't control others. But we do have the ability to set boundaries for what we are going to accept and tolerate. So I can say, I can't say, don't yell at me anymore, Deb. What I can say is, I am making the decision that I will not tolerate being yelled at. And I will remove myself from the situation. And it sounds like semantics, right? I mean, it just sounds like we're just playing with words, but really it's a really big difference.
Sure.
Right. So I just want to say thank you all for taking this time and for letting us be part of this with you. As whether you're an attorney working with families, whether you are someone in the prosecutor's office or who's going to experience working with the drug court, whether you're a therapist, whether you're just a person who's interested, everyone listening has contact points with addicted persons, with the children of persons with addiction, and with the family members. And so our hope is that in whatever your capacity, you will find a way to be a support, and we hope that this helps you guide folks better.
Yeah. And I would add to that we all have a similarity in that we may be the one person who is at the entry point of someone who's been spending a lot of time making a decision about whether or not to ask for help, whether or not to change their scenario. I mean, we can see people live in the kind of lives that you're seeing for a very, very long time. And so I always take note and recognize for myself, and I hope you do too, that when someone finally is in front of me, the first thing I say to them is, this is the bravest thing you've ever done, is to come and finally say, I can't do this anymore. Either because I need to change, I can't live like this and I can't cause so much trauma for myself and others, or a family member who's coming and saying, I can't live like this anymore or have my children live this way. So it's often frustrating to watch people in that moment, and it may be quick for us to come to this place of judgment, but
right.
I've never met more brave people who are willing to change.
Right.
And it usually takes a really long time. You know, you're almost the end result of that. We are the end result of that
right.
balance of should I or should I not change. And so I think the first thing that people need to hear is, you've come to the right place, and you can get help, and you can live a better, more peaceful, much happier life. And that I think we share
absolutely
among all of us.
Absolutely. Thank you, Deb. I appreciate it.
Thank you, Dr. Dyben.
Thank you all.
Wow, that was a really great detailed presentation. Without wasting any further time, we are going to hear from the folks from the Florida Lawyers Assistance now to help us understand what resources are available to attorneys.
All right. Hello, everybody. My name is Molly Paris. I'm the Assistant Director of Florida Lawyers Assistance. And I have my colleague, Dr. Scott Weinstein, our clinical director, here with us as well. And we are going to be doing this webinar for you all. We were hoping to see everybody back in April when Eddie Stevens organized this wonderful seminar for the family law lawyers, and understandably that had to be canceled, and I'm so grateful that we can reschedule it even if it is not in person. So we're going to be talking about mental health and wellness and substance use in the legal profession, and I'm going to get started by talking a little bit about Florida Lawyers Assistance and a bit about some substance use issues, and then I'm going to turn it over to my esteemed colleague, Dr. Weinstein, to talk about stress, mental health, wellness, and ways that we can take care of ourselves in this in this profession, and especially during these very, very uncertain times. So I'm going to share my screen so you all can follow along with the PowerPoint. I'm also going to provide the PowerPoint to Mr. Stevens so that any of you can have a copy of it as well. So thank you all for attending. I'm sorry we couldn't be together in person, but this is the next, certainly the next best. So to start with, Florida Lawyers Assistants, I'm going to share my screen so we can follow along with the presentation. Okay. Give me a moment. Okay. All right. So stress, mental health, and substance use in the legal community. Florida Lawyers Assistants, many of you, I don't, since I can't see any of you on Zoom or otherwise, I don't know the age of our, or experience of our participants today, but I know you're all Florida attorneys. So at one point you took practicing with professionalism. And during that, it was you know, in our first year or two of practice as Florida attorneys, we have to take this practicing with professionalism course, and it has a series of different 1-hour segments, and Florida Lawyers Assistants generally gets an hour, and you know, get to learn about the Lawyer Assistance Program. However, on that day, there is so much information. Many people, as they go on with their practice and the years go on, don't remember who Florida Lawyers Assistants is at all. So I'm going to tell you a little bit about that. Florida Lawyers Assistants it's a separate not-for-profit organization, and we are funded by the Florida Bar. And even though we receive our funding from the bar, again, we're a separate entity, and I'll explain the reason why that's so important in a moment. It has to do with confidentiality. And we work with attorneys, Florida attorneys, whether you're in the state or out, law students, and we also work with judges. And we help the legal profession, any member of the legal profession, with issues relating to stress, mental health, wellness, and also substance use. And there are 3 different ways that attorneys, students, applicants, judges come to us, 3 different ways. And the first way that we interact with people, one of the ways, not the first way, and preferably not the only way, is through the discipline system. We work with the Florida Bar. Oftentimes there will be an attorney, for example, who has a substance use or mental health issue that comes up in either a bar complaint, or perhaps they had a criminal case, a DUI, or some other type of criminal issue, and they will get referred to Florida Lawyers Assistants. We will evaluate them, work with them, determine if services are needed. If they're on probation with the bar, we work in conjunction and help to rehabilitate the person so they can be a happy, healthy member of the legal profession. So that's one way we work with people. Another way that we work with people is through the application process, whether it's a law student or an applicant from another state. If you all remember, it's been quite some time. I'm a Florida attorney. It's been quite some time since I have filled out the bar application, but on the bar application, there are a couple of questions that have to do with substance use and mental health. And often if those questions trigger a positive response, often the Board of Bar Examiners will send folks to us and say, okay, we have an applicant here. They look like a very promising prospect. However, there's a DUI in the past, or there's a mental health condition that we're concerned about. Please, work with Florida Lawyers Assistants during the application process so that we can see that you are taking care of what you need to take care of. Whether if it's a substance use issue, that you're involved in treatment, that you're staying sober. If it's a mental health issue, that you're getting the help that you need. And again, so that's the way that we work with people. Oftentimes sometimes the Board of Bar Examiners will send people to us. Often students and applicants will just come to us voluntarily at the outset and sort of proactively address that issue because they know it's going to be an issue with the Board of Bar Examiners. And the third way that people come to us, and this is our absolute favorite way, and this is why it's so important that Dr. Weinstein and I go out into the community, right now the virtual community, to address folks so that people know that we are here. So we also work with people, as I said, voluntarily. Any attorney, law student, applicant, judge can call us, and it's completely confidential. If you're referred to us one of the first two ways, through the bar or the Board of Bar Examiners, obviously that is not confidential. You're already part of that, either the discipline system or the application system. But what we most like to do, and what we really are trying to stress here, is that people can come to us, can call us, and it's completely confidential. And we have been around, and that's if you take nothing else from this webinar, please remember that Florida Lawyers Assistance is here. We're available to answer the phone. We have groups all over the state, as you'll see in this slide. We have over 300 volunteers. Often those are other attorneys in recovery, and we have groups all over the state. Dr. Weinstein runs some clinical groups himself, and we also can help people refer you to a therapist in your area. We also can provide some support. If it's not something we can handle directly, we can certainly connect people with resources. And that is really, truly what we are trying to encourage, is voluntary participation in our program, because we want to see people before the discipline system, before the DUI, before the hospitalization. We really are trying to help people be proactive and take care of themselves, because this is an incredibly stressful profession. And so that I cannot stress that enough. So as far as how FLA works, as I mentioned before, we have volunteers all over the state. We have groups. We are available to talk to folks. We're also available to do a lot of outreach like we're doing now. Dr. Weinstein and I go to many law firms just to let people know that we are a resource and that we are here. We also work with governmental agencies. We do a lot of work with the Public Defender's Office and prosecutors, these professions that have a really high chance of compassion fatigue and stress. I think every part of and Dr. Weinstein is going to talk a little bit about compassion fatigue. I know primarily in our audience today, we have family lawyers. That is an incredibly, that's a part of our profession that is prone to a lot of this burnout and fatigue. And so it's really important that you all know that we're here. The reason why, when I mentioned in the beginning that FLA is separate from the Florida Bar, is because of confidentiality. In voluntary cases, you can call us, you can contact us and not even give your real name. It doesn't get reported to the bar, to your employer, to the police. As you can see, we're folks that call us are protected by both Florida Bar Rule and Florida statute. So in addition to that, the attorneys that work at Florida Lawyers Assistance, I'll tell you about our structure in a moment, we are exempt from the reporting rule. So if an attorney calls me and reports that they're having an issue with drug use or other, I'm exempt from the reporting rule. Chances are that attorney will have already gotten into some sort of issue and someone else may have reported them to the bar. But as far as the attorneys that work at Florida Lawyers Assistance, we are exempt from the general reporting rules. So that's, again, as I said, one of the most important things that we want people to know is that before you are lawyers, you are human beings. And we're very fortunate now. I believe we have a long way to go, but a lot, one of the big issues that we hear often is stigma, and the Florida Bar has done a tremendous job. The Young Lawyers Division in particular has done some really wonderful work as well, and the bar as a whole. The new bar president has committed, is clearly committed to mental health and wellness, and actually the Florida Bar has a lawyer's helpline that's an additional resource for people. So the bar and our profession as a whole is really starting to talk about these issues more, to talk about, you know, it's okay to get help proactively. It's not a sign of weakness. It's not but we all have a lot of work to do. So I'm going to talk a little bit about substance use in the legal profession, and then I'm going to turn it over to Dr. Weinstein to talk more about mental health and mental health and wellness and stress, and more importantly than telling you about the statistics and how grave it looks in our profession, he's also going to talk about some solutions as well. So very briefly, you know, in 2016, Hazelden and Betty Ford and the American Bar Association did a study on attorneys. And if you can see, these results are pretty staggering. 33% of lawyers are problem drinkers, and particularly in that first decade of practice, 29% of lawyers in the first decade of practice report problem drinking. One of the reasons, this I neglected to mention before, Florida Lawyers Assistance has been around since the 80s, more informally in the 70s, just one lawyer helping another. But the Florida Supreme Court determined that so many of the discipline cases that were coming through had to do with either substance use, mental health, gambling. We'll talk about that in a moment. There are a lot of different ways that addiction can manifest itself. And they found that, and that's when they mandated that an organization be created or that an entity be charged with providing mental health and substance use assistance to lawyers and to our legal community, because so many of these discipline cases had to do with that. And so many folks that end up in the discipline system can, in fact, be rehabilitated with the proper support. And that's what FLA is here to do. So the definition of alcoholism, alcohol still is the most common drug of choice, if you will, in our profession. And there are many different definitions of alcoholism. Doing the same thing over and over again, expecting a different result, you know, with your drinking, drinking in the face of serious consequences. You know, those of you, and I know that this comes up, these issues come up often in family law cases as well. I'm sure you're all probably very versed, more versed than you probably ever hoped you would be on some of these issues. And oftentimes we'll see someone with 2, 3, 4 DUIs. A non-alcoholic may get scared enough after the first time to think, I'll never do that again. And the alcoholic, the active alcoholic or addicted person may, again, deny, justify, I'll only drink beer, I won't drink the hard stuff, I won't. So there are many ways that alcoholism can manifest itself, and there are many definitions. So these are some warning signs. But before I go on, I want to talk a little bit about my own experience with Florida Lawyers Assistance and how I came to know of this organization and ultimately work here so I can help other attorneys. I'm an attorney. I'm licensed in Illinois, New York, and here, and I practiced law in Illinois for about 8 years, and then I moved to Florida and became a Florida attorney. And while I was in law school in Chicago and after, you know, in addition to my legal career advancing, so did my alcoholism. And I developed a pretty severe drinking problem. And I don't know when exactly it started. I just know that it did. It was an issue in law school and then early in my practice. And fortunately, I was very fortunate. I did not have any issues with the Illinois bar or with any legal issues related to that. However, I was very slowly killing myself and able to function, able to practice, but just a pretty serious drinking problem. So ultimately I moved to Florida and I decided to get help. And I won't get into all of the details. One of the things that we always want to do too is make sure that people have our contact information if anyone ever wants to speak to me. But I ultimately moved to Florida and then decided to get help. I checked myself into treatment. I got a handle on my alcoholism, and at this juncture I've been sober for over a decade, and it's been extraordinary. But I share this with you because I want you to know about a little context with Florida Lawyers Assistants as well. When I was in treatment, I had already been a practicing attorney for for a number of years. I was really, it was incredibly humbling to be there. I was terrified. I didn't know what happened. I wanted to stay in Florida because I had family here and I wanted to become admitted to the Florida bar. But I knew that would probably become an issue, since I had just been in treatment and I would need to disclose that to the bar. And when I was in treatment, this is again 11 years ago, my counselor there said, don't worry so much. I'm sure you'll still be able to do the profession that you love. And I've been a civil rights lawyer for 20, the past 20 years, and still until I started working at FLA a few years ago. And I'm one of those lawyers that actually love being a lawyer. So the thought of not being able to practice or not getting admitted to the bar here in Florida was pretty troubling to me. And this counselor recommended that I call FLA. So I remember he let me use the phone in his office, and I called, and Michael Cohen answered. He was our former director. He was our director for about 25 years. He was also in recovery. He was an extraordinary attorney and an extraordinary human. And he shared his story with me, and he shared his story about what happened and what it was like for him now. And when he spoke to me and when he shared his own story with me, I felt that was a real turning point for me, not only in my career, but in my life. And that's how I came to know FLA. So I became voluntarily involved with FLA. I had FLA help me with the Florida bar issues that I would have, because of my history of having been in treatment. And, ultimately I also became a Florida lawyer and went on for quite a few years to volunteer for FLA. But I share this with you, not just to out myself for that purpose alone, but to let you know that there's a real face behind what this organization can do. It has helped me tremendously in my recovery and in my life. So I like to share that with folks. So not only do you know that this works, but also so you know that if you or anyone else is struggling, I'm here to talk, and I'm here to support people. So it's important that I share that with all of you. And a few years ago, we realized that not just the substance use issues, but mental health, that FLA really needed to be out there more, hitting the pavement, talking to people, making sure people knew that they could come to us voluntarily, not just through the discipline system or the application system that we are here. And it was at that time that the Florida Bar generously gave us additional funding to hire an outreach person, and so that we could do just that. So a few years ago, I had the opportunity to come and come on with FLA, and it's been great. I enjoy, and this is actually my favorite part of working with FLA is being able to go out and tell people about us and try to get that sort of proactive solution for people, to get people to come to us before the wheels have come off. So a few more things about alcoholism, and then or about substance use, and then I'm going to turn it over to Dr. Weinstein to talk about mental health and wellness and the solution. So these are warning signs. Again, Mr. Stevens, I'm sure will be able to provide this PowerPoint, so you'll all be able to have a copy of it. Other addictions, You can see them listed here. Often people will trade one for another. Often I see people that will have stopped drinking, all of a sudden become compulsive gamblers or have issues with food. Again, there are many ways that addiction can manifest itself in our lives and the lives of our families and our coworkers. So I'm going to turn it over to Dr. Scott. And as I mentioned before, in addition to this PowerPoint, I will make sure that you all who are participating in this webinar today have our contact information as well. It's at the end of this PowerPoint, so that if anyone should need to reach out to us for any reason, that please do so. It's confidential, it doesn't cost anything, and we are here to help you. So Dr. Weinstein, I turn it over to you. I'm going to give you screen sharing capabilities as well, and also turn off my video so you can have the stage. All right, and so welcome, Dr. Weinstein.
Thank you, Molly, and thank you, Mr. Stevens. And I am glad we've had this opportunity to be here with you, well, sort of virtually anyway. We have been working, our office has been working virtually since the middle of March. So this is something that we've become much more comfortable with, and unfortunately, because of the virus and the pandemic that it's made us a little bit more flexible, but also kind of taken away from the face-to-face connection that we all really love. Let me just get my PowerPoint thing going in the right direction so you all have the right piece. Okay, here we go. Okay, all right. Again, thanks for being here. I'm going to take you on a little bit of a journey in terms of what it means to kind of acknowledge the mental health challenge of individuals. When I first started with FLA about 16 years ago, my colleagues at the office recognized that there was more than substance abuse challenges affecting the profession. And they wanted someone who had an understanding of the whole scope of mental health challenges. And so they were generous enough to hire me. I have come to really enjoy what I do here and really start by what I always do the first time I meet anybody is welcome you back into the human race. Because what I found early on in working with attorneys and working in the profession is that somehow the training and the practice of law sort of shuts that part of us off, or at least challenges us to shut that off. And we become more or less programmed to perform and be oriented towards just solutions and really put all the feelings and all our other humanity behind. And as I've watched this happen year after year, I would say 99% of the cases that are referred to us are a result of an emotional challenge to the individual, whether they are being directed here through a discipline matter, or they call up and say, Doc Weinstein, I can't get out of bed. My marriage is falling apart. My practice is falling apart. I don't know what to do. I have clients I'm not responding to. I got a complaint from the bar that I can't open the mail. And I just don't know what to do. I'm reaching out. And that first call to us is an amazing experience for me to know that what courage it takes to do that. So I always acknowledge that when someone reaches out to us and tell them, I commend you on that courage. And the journey of healing together. Molly did a wonderful job talking to you about the substance abuse, or substance use part of our program. And a lot of times they go hand in hand. Many of our clients are struggling with some kind of mental health disorder, whether it be depression, bipolar disorder, very, very acute anxiety, and have found out that if they take a few drinks of alcohol every day, or they take some medication, they somehow quiet the demon. So a lot of the individuals come to us with what we call a dual diagnosis. But again, as I view it, it's all an attempt to shut down the pain, the struggle, and the suffering that is happening in an individual's life. Fast forward to now, about 3 months ago, 4 months ago, our country was hit with this pandemic that just threw everything else on its head and just spun us out of control. Dealing with this isolation and dealing with the fact that we are having to radically adjust the way we practice everything from our jobs as lawyers to our family life to our social life has added a challenge that we've never ever experienced as individuals, at least in my lifetime. And so we talk about what a lawyer's world is like, and as you can see on the slide, a lawyer's life is fraught with conflict, and you are charged with helping people. They call you up and say, "I got a problem," and you're charged with helping to fix that problem. Okay. In addition, the hours are getting increasingly longer, and I find now, when I speak to attorneys and folks in the profession, because of the pandemic, there's no downtime. They feel like they're available 24/7. The computers are at home, and people are just responding at any hour of the day, which is very difficult. And clients now think that because they have a captive audience and the attorney being home, they can also reach out, throughout the night and the wee hours of the morning. So I want to talk about later the concept of boundaries, because that's going to be something that is going to help most of us, deal with these incredible times. Goes on, judges, clients can be difficult, colleagues can be difficult. And, you can read here that you're going to be challenged on levels that you've never been before. And I'm sure in your practice of law, especially family law, it's also fraught with a lot of emotionality. It's one of the more emotional parts of the practice of law. You're dealing with family issues, children, people's, possessions, and it gets very, very, very highly emotional. And it takes everything from you to kind of retain your your professionalism, and also step away when you can from the emotionality of the case. There's lots of studies that are going on now talking about the mental health in the legal profession. Lawyers have a very, very high rate of depression compared to the rest of the population. Suicidality is also high, anxiety is also high. And again, it's because of the number of factors that I mentioned a moment ago. You're dealing with very emotionally charged situations, you're dealing with high demand, and you add that, following rules and having sometimes little control of how the judge makes a ruling in a case, and then add to the fact that we're dealing with this pandemic. It's a real mix of potential difficulty, which also leads to all these symptoms that we're hearing more and more being reported. We talk about the suicide rate of attorneys. It creeps up and down over time. There's always an ongoing debate whether attorneys are ranked number 1, 2, or 3 to other professions in terms of suicidality. But suicide is really the end result of a person believing in the moment that they don't have any other way out. Oftentimes, a phone call to somebody can prevent that from happening, and yet people feel very, very, have a difficult time saying, "I'm having these really dark thoughts." When someone calls the office and I get them on the phone, I do not hang up until I ask that question. And I say it in a way that I don't mean to be insulting or disrespectful, but I need to know if you have any thoughts of taking over what's going on. And I've never heard anyone tell me, "What kind of ridiculous question is that, Dr. Weinstein? How dare you ask me?" They mostly say, "Well, I don't have any plans. I thought about it. And sometimes I don't want to wake up in the morning because things are difficult and I just wish it would all go away, but no, I don't have any plans." Or somebody will say, "I thought about it and maybe had a previous attempt, but now I have reason to live. I have family, I have friends, I have something that is also going to keep me going, and I'm reaching out because I don't want to go there again. So there's always a progress in terms of anyone's mental health concerns. And as far as something that we can offer as a open to the profession is, if you have any colleagues or any that is acting in a strange way and you might be concerned about their mental health condition, you can certainly have them call us and we can ask that very hard question over time. Or you can basically say, I'm worried about you, like I'm concerned, I see things are going differently. What's going on? You want to talk about what's happening, and hopefully they'll open up. And generally people who are suicidal are going to do it regardless, unfortunately. But talking about and asking the question will not lead someone to say, hey, that's a good idea, I think I'll do that tonight. And that's one of the things that I think a lot of people are concerned about. If I talk about suicide, is that going to make someone do it? And generally speaking, that's not the case. Unfortunately, there's been some high publicity cases. This gentleman, Irvin Gonzalez, who, from what I found out, was the who's who of attorneys in the South Florida area, and all these accolades and people. He touched many people's lives. Had something go on, and he had a very dark place, and he went there, and he ended his life several years ago, which shook the legal profession, especially in South Florida, to the core. And then, so this is what was going on with Mr. Gonzalez. And so for those of you who aren't quite at that level, and hopefully many of you aren't, there is a level of stress that goes on with any practice of law, and especially in the family practice. You're getting people's intimate details of their lives, and you have to manage all that. And I work with a number of family lawyers who have to juggle being a lawyer and being the counselor to their clients, and I hear that often. And it's exhausting on an emotional level for the attorneys, and it sometimes interferes with their ability to work the case, because they have to sometimes just deal with a crisis that has nothing to do with the legal issue in the moment, but they'll get a call from the client saying, I need some help, and oh my God, and what do I do? And they find themselves trying to balance how they deal with those issues. Fortunately, a number of attorneys have ongoing relationships with mental health professionals, and they're smart enough and wise enough at those times saying, hey, I think this is an issue. You can call someone who is better trained to deal with that. I will continue to work on your case, and with that help, I think will help you get through it better. So that's good. But for those of us who are having a hard time in general with stress at work, we've come up with some solutions that sometimes work. Exercise is historically one of the best ways of dealing with stress on so many levels. Physiologically, it kicks in the endorphins that help us feel better. But again, now with many of the gyms being closed down because of the pandemic, is a challenge. Those of us who are gym rats, and I can tell you, I'm not ever been one of them. They are saying, what do I do without my gym? So we're now being challenged to come up with creative ways of doing things that we took for granted, that we're able to do on a regular basis. We're no longer able to do those regularly. So you see on the internet very, very clever ideas of how to create weights and make weights. People, fortunately, are still allowed to go outside and do some aerobic exercises, and there's other ways of dealing with the challenge of not having your gym available to you. Leading a healthy lifestyle. Again, we're home more often. Some people find being home more often more difficult to follow a healthy lifestyle. We have all our food, all our snacks available to us. The stress level is getting higher, and it's easy to walk away from our desk right into the kitchen and help ourselves to something, or conversely order something to be delivered to the front door. It's not like having something delivered to the office. So it's always important to keep in mind that we need to keep a healthy lifestyle in terms of nutrition. We go down the list, taking one thing at a time. That's becoming a bigger challenge than I ever imagined, and I'm hearing more is that people are juggling more while they're working at home. So again, it's management of as project management in addition to time management. And again, we're getting the Superman, Superwoman issues are creeping up even more. And so this time is especially difficult for those of us in a professional light, and especially attorneys right now, because there's added stress and burden to our what was just generally a very stressful profession. We talk about resilience, and this is a term that's getting more and more kind of study right now in the issue of mental health and wellness. Basically, resilience is how can you fight off the effects of stress and challenges that maybe you haven't thought about. And again, the emotional world is one of those things that attorneys, again, are not real versed in. And so a lot of resilience is really developing a emotional intelligence. And some of you might have heard that term. It's how to deal with your emotions on a way that are not going to let them overwhelm you or get in the way. And that's a challenge that many of us have. And that's often a time where working with therapists will help a whole lot, because they can help get that into perspective for you and point out how you may improve your ability to increase your resilience, and especially in the face of high stress and what we're going through now. Again, let's talk about, okay, so I'm stressed. What do I do? How can I get through this? And again, simple things like resting, ability to process your feelings, your thoughts. When you're working remotely, you don't have necessarily the staff around you anymore. And then there are some people who have solo practices who have never been able to process a whole bunch with other staff, with other colleagues in the office, but maybe you had a paralegal or an assistant, and you, at least for a moment, you can touch base with one another. But now working remotely, that's been taken away from us in a lot of ways. So a lot of times it's sitting back and just processing within ourselves. And I would also encourage you, to reach out to a colleague, to take a break and say, hey, I just had a really difficult time. And if you have a friend who's in the profession who can understand what you've been through, take a moment, give a call, or send an email and say, when you get a chance, can I chat with you for a bit, because I just had a very difficult moment. And that's something that is hard to do. Again, reaching out for help and not thinking that you can just take everything on and fix everything all by yourselves. Generally, those of us who are in a profession like this are very competent. We're good problem solvers, but sometimes when we're dealing with our own issues, we have a more difficult time. So getting personal support, professional support, talked about, and again, Florida Lawyers Assistance, because our job is to really support you. We're here and we're doing this today to let you know that we want to be a partner in your world and your day-to-day practice if you need us to kind of help you cope with stuff. We have the therapy groups that we offer around the state. We have referrals to individual therapists. We have support groups for substance use issues. We know that you can be affected by all that, and the way to deal with that is to really be involved or get in contact with someone like us sometimes. And again, as Molly mentioned earlier, the calls are confidential. If you call on your own, we are not obligated, whether we're a lawyer or otherwise, and I'm not a lawyer, I'm a psychologist. We don't report those kind of calls. We'll talk to you and say, okay, what's going on, and we'll hopefully point you in a direction that will help you, get things back in order. Come at this from an employer perspective. I'll give a very short acknowledgement. Employers are now starting to understand, if you're working in a firm, that it's important to support the staff on a level that gives them some mental health support, because a better functioning employee is going to ultimately be better for the firm. And then we talked about in more depth how they can establish well-being committees in some of the larger firms. Some firms are embracing this very wholeheartedly, and some are still somewhat reluctant because they're kind of like stuck in an old model of how a lawyer and how a law firm should conduct themselves. We are sensitive to that, but we're also trying to help them understand that in these new times and these new challenges, maybe we can look at things a little differently. Talk about that. Understanding workplace stress, why it matters. Essentially, it's good for business, whether you're a solo practitioner or part of a firm. We're all here to help, but also make money. And if we have, if our mental health is in order, we're generally able to be more successful, which translates into profitability and productivity, and being, increased client satisfaction. One of the things that I always remark is that as professionals, we are very selfless sometimes, and many of us are caught in the cycle of being available to our clients too much, and that's to our detriment. And I'll just kind of direct you to a metaphor that for those of us who know about being in an airplane back in the day when flying was safer, that pre-flight instructions that we kind of give maybe half an ear to. They say in the event of a problem, or we're over water or something, there's going to be some oxygen masks, dropping from the ceiling. And what I don't understand is why there's always 3 masks over 2 seats. I haven't figured out that dilemma yet. But that being said, they always say, for those adults who are traveling with children or someone in need, grab your mask first, put yours on first, and then put theirs on. And the reason is, if you're able to be okay, you can help the person who can help. Same thing goes with being an attorney. If you recognize that you need to be taken care of and you need help, put your oxygen mask on, reach out for that support so that you can be a better attorney and be better available for the needs of your clients. And that's what I just talked about. And of course, it says it's the right thing to do. We spend at least 50% of our waking lives working. I'm thinking it's more like 70 to 80 nowadays. And if our identity is so wrapped up in being an attorney, and when things don't go well, we don't know how to cope with things, that should be a yellow or red flag to say, hey, I need to reassess my reality and my identity. Let me take care of me first, me the person first, and then I can go back to doing my job the way I was trained. Again, this is the end of the formal presentation, but I want to talk about, in a sense, just an overall sense of what we're doing lately. Since the COVID pandemic, we have opened up our resources to the entire state of Florida, and I run, support groups on Wednesday afternoons, which is starting in about 8 minutes, for any attorney who wants to come online and talk about what it's been like, and those groups are absolutely free of charge, and they're fairly new, but I'm getting a very, very nice response to those groups. We have a pretty decent return rate of attorneys who have sounded to be a very useful resource. But in general, FLA is here for your needs. We are an organization that is dedicated to supporting the profession. And the bar relies on us to help attorneys out because they want to protect the public, and a better functioning attorney is going to help the bar protect the public in terms of what could happen. So I'm going to wrap up and say thank you so much. I'm going to ask Molly if we anything else to add to our presentation today.
Thank you very much, Dr. Weinstein, and thank you all of you for participating. As I said earlier, the PowerPoint will be available. It also has FLA's contact information on it, so please reach out to us anytime. And if you see any of your colleagues struggling, please use us as a resource as well. Even if none of this applies to you, it may apply to one of your partners, one of your associates, one of your fellow attorneys or judges, and we're here to assist. So thank you all, and I hope everyone stays safe and well. Bye. Thank you, Dr. Weinstein.
Thank you, Molly. Thank you, Mr. Stevens. Bye now.
Thank you, Mr. Stevens, as well, for organizing this.
And here's a word from our sponsors.
So without need for further introduction, the next segment that you're going to hear from our own Eddie Stevens, and he's going to try to stump RT White with 30 questions involving ethics. This is a fun part of the program, so enjoy.
All right, our next guest at the second annual Family Law Mental Health Summit, a good friend of ours, and you heard him last year if you came, Ralph White, board certified attorney, AAML fellow, and ethics expert. Ralph, are you with us?
Yes, Eddie, how are you this morning?
I am fantastic, and thank you for joining us, and you look wonderful.
Try to look as good as the host, Eddie.
So we're going to do 30 ethics questions in 30 minutes. Are you ready?
I am ready, Eddie.
All right, I'm going to fire some questions at you, and you're going to respond. Question number 1, I have received a subpoena for a client's file from the Internal Revenue Service. What do I do?
Well, the confidentiality rule provides that with certain limited exceptions, a lawyer shall not reveal information relating to the representation of a client without the client's consent. Now, a lawyer's files, which obviously contain information relating to the representation of clients, are protected by the confidentiality rule. Therefore, absent consent from the affected client, a lawyer should voluntarily refuse to release a client's records to a third party. Now, once the lawyer is served with a subpoena, however, the issue changes from one of confidentiality to one of evidentiary attorney-client privilege. So there you have a lawyer's client's records. They're subject to a subpoena by a third party, and you should refuse to produce the records on the grounds of attorney-client privilege if the privilege might be possibly applicable. And then any doubts about the applicability of the privilege should be resolved in favor of non-disclosure of the records. So if a third party then obtains a court order requiring production, the lawyer may comply with the order and release the records as ordered.
2, may I charge interest on a past due account?
Yes, you can. There's no ethical prohibition against a lawyer charging a lawful rate of interest on liquidated fees or costs. A lawyer who wishes to charge interest on past due accounts, however, must do so either by 1, written agreement with the client, or 2, absent of a written agreement, by giving the client reasonable notice of intent to begin charging interest. And they've deemed that 60 days is reasonable notice to give to your client.
3, what is meant by the term of counsel?
An of counsel relationship is more than a mere referral arrangement. A lawyer may be considered of counsel if he or she has regular continuing relationship with a lawyer or a law firm in a capacity other than that of a partner or associate. Because of this close relationship, lawyers in an of counsel relationship are considered to be in the same firm for purposes of conflict of interest rules.
Number 4, I share office space with another lawyer. May we use letterhead that shows both of our names but disclaims that we are in a partnership?
No, you cannot. The rule prohibits lawyers from stating or implying that they practice in a partnership or other organization unless it is true. Therefore, in order for lawyers to practice under a name such as Smith and Jones, a bona fide partnership or professional association must exist. A statement that the lawyers are not a partnership could confuse or mislead the public.
5, a lawyer is leaving our firm. Which firm clients, if any, must be notified of that lawyer's departure?
The firm clients, whether they're brought into the firm by an associate or otherwise, for whom the associate rendered legal services, should be advised that that associate is leaving. The law firm and the departing lawyer must engage in bona fide negotiations for a joint letter from the firm and the departing lawyer advising those clients of the lawyer's departure from the firm. If the lawyer and the firm cannot reach an agreement on a joint letter, the departing lawyer and the firm may send a notice to the client stating that the lawyer has left the firm, asking the clients to indicate whether they wish to be represented by the firm, the departing lawyer, or another lawyer, and follow other requirements as specified in the rule. The bar has an informational packet, Eddie, entitled Notifying Clients of Change in Firm Composition. So if someone is going to leave your firm, the first thing a lawyer should do, if you're a partner in a firm or the head of your own firm, you should get your hands on that packet to make sure that you follow the bar rules.
It has a pretty good sample letter in there too, doesn't it?
Yes, it does.
RT question number 6, how long must I retain closed files?
Well, with the exception of trust accounting records, which you have to hold for 6 years, contingency fee contracts and closing statements in contingency fee cases, that's 6 years. And the statement of insured clients' rights, you have to hold those for 6 years. There's no specified number of years for which lawyers are required to keep closed files. Similarly, there's no set time period after which closed files may be destroyed. The Ethics Committee has stated that the appropriate length of time to keep a file depends on what is in the file and the nature of the case. So the committee established guidelines for lawyers who wish to dispose of closed files. The lawyer should first attempt to contact the client and obtain directions as to the disposition of the file. If the lawyer is unable to contact that client, the lawyer should review the client's file and remove any original documents or important papers, i.e. wills, contracts, etc., that may be later vital to that client's interest. And then any papers must be indexed or retained for a reasonable length of time. The lawyer may then dispose of the file, the remainder of the file, and if you're going to dispose of the file, you have to use reasonable care to make sure that you protect client confidentiality. So you just can't take the old file and throw it out in the dumpster. You probably should shred it or contact a shredding company and destroy the file that way.
RT, I'm holding money in my trust account, settlement proceeds that belongs to a client. Client hasn't contacted me and I have no idea about their whereabouts. What do I do with the funds in my trust account?
A lawyer holding trust funds for a missing client must make a diligent attempt to locate the client. While attempting to contact the client, the lawyer's trust account records must reflect that the funds are being held for a missing owner. If a diligent attempt to locate the missing owner is unsuccessful, the rule directs the lawyer to dispose of the funds pursuant to the procedure outlined in Florida statutes.
8, am I required to participate in the interest on trust accounts, the IOTA program?
The Florida Supreme Court has stated that all nominal or short-term funds belonging to clients or third persons which are placed in a trust account with any member of the Florida Bar practicing from an office or other business location with the state of Florida shall be deposited into an interest-bearing IOTA trust account.
Number 9, several years ago, I represented a client in a residential real estate transaction. Now another client has asked me to represent her in suing my former client on a divorce matter. Ethically, what determines whether I can take the case against my former client?
Eddie, there's a three-pronged test that must be satisfied before a lawyer can represent someone whose interests are materially adverse to those of a former client. Unless the former client consents after consultation, the lawyer may not, 1, represent the present client in a matter that is the same as or substantially related to the matter on which the lawyer represented the former client. 2, use information relating to the representation of the former client to the disadvantage of the former client unless the information has become generally known. Or 3, discloses information relating to the former client's representation unless the rule allow or require disclosure. Contrary to what some lawyers believe, confidential information is not the sole test. All prongs must be satisfied. So using that scenario, assuming that it was just a standard real estate transaction, I don't necessarily believe that you could not represent the other party in the divorce.
Number 10, in settling a case for my client, the plaintiff, is it ethical for the attorney to agree not to represent any other clients in bringing similar suits against the defendant?
No, the rule prohibits a lawyer from offering or making any agreement in which restricts a lawyer's right to practice in part of a settlement of controversy between private parties.
Number 11. You're doing good so far, RT, by the way.
Am I keeping? I think we're keeping on track. I feel like at the end there's going to be like a bell that's going to go off.
I think after every right answer, we'll do a bell. We can add that in post-production. Number 11, I anticipate that I will need to testify on my client's behalf. May another lawyer in my firm represent the client at the trial in which I will testify?
Yes, under the present rule, only the testifying lawyer is disqualified for this reason. The rule expressly states that the remaining lawyers in the firm may represent the client at trial unless precluded from doing so for other conflict reasons.
Number 12, when must a fee contract be in writing?
Written fee agreements are required for all contingency fee contracts, not just personal injury and wrongful death. The rule states that any agreement to represent a client where the lawyer's compensation is to be dependent or contingent in whole or in part upon the successful prosecution of settlement of a matter must be in writing, signed by the client. Also, a client must consent in writing to agreements that limit the scope of representation of an attorney. And then finally, Eddie, agreements to follow the collaborative law process in family law matters also must be in writing with the client.
Ethics aside, what do you think about best practices for written fee agreements?
Certainly, your best practice is always to have a written fee agreement.
Question 13, how do I change my official bar name?
Well, this one comes up a lot in that lawyers leaving firms, whether they're associates or partners leaving, for some reason, people forget to go and change their information on the bar website, which you're required to keep updated. Now, when you have to change your name on the bar website because of maybe a divorce or marriage, the Florida Supreme Clerk's Office requires that you have to send a letter of the completed name change to the Supreme Court's office to change on the list of the roll of attorneys. You need to include your current bar name, and you need to give them your new bar name, which would include your first, middle, last names, and your Florida bar number. Surprisingly, according to the Florida bar, this is an issue.
Good to know.
That people aren't doing.
14, well, we're educating them, so that's what the purpose of this seminar is. 14, when can I disperse trust funds after depositing a check?
In general, a lawyer cannot disperse until trust funds are collected. Collected funds means funds deposited, finally settled, and credited to a lawyer's trust account. Now, a lawyer may disperse against uncollected funds in trust accounts only when one of the 6 enumerated exceptions applies. Although it's permissible to disperse funds under the 6 exceptions, disbursement against uncollected funds is not required. Disbursement against uncollected funds is at the risk of the lawyer who is still the guarantor, and the enumerated exceptions are if you have a certified check or a cashier's check, the check for the loan proceeds comes from a federal or state chartered bank or other institutional lender. If you have a bank check, official check, or money order and checks issued by a bank, credit union, or a savings and loan, any federal or state government checks, or a check on another Florida lawyer's trust account or the escrow account of a Florida licensed real estate broker. Under those exceptions, you can issue and disperse trust funds even though those aren't technically collected because they haven't been credited to your trust account. However, you're still on the hook because you're the guarantor.
Sure. Good to know, though. Next question, number 15. My client owes me fees. Grr. Can I sue him?
No, you can't, Eddie. A lawyer cannot sue a current client. In Florida Ethics Opinion, the committee stated that a lawyer cannot take action against a client to enforce a fee agreement before the representation is ended, either by withdrawal or by conclusion of the client's matter. The committee reasoned that suing a current client would create an impermissible conflict of interest between the attorney and the client.
Question 16. Can I give a second opinion to someone who is represented by counsel?
Yes, you can. A lawyer can provide a second opinion to someone who is represented by counsel concerning how that current lawyer is handling the case, and you may give information on the services the lawyer might provide. However, you need to be very careful that you should not solicit the person who is currently represented.
Number 17, can I call myself an expert or specialist if I'm not board certified?
Yes, you can. If you can objectively verify the claim based on your education, training, experience, or substantial involvement in the area of practice in which specialization or expertise is claimed.
And that's a pretty recent change to the rule, isn't it?
Yes, it is.
And if
Because
go ahead.
it came out of, not all areas of law had board certification. So there was some concern by some attorneys that, there was no board certification exam for their specific area of law. And, they changed the rule to allow people to claim that they were a specialist or had this expertise.
So that only applies if there's not a board certification available for that area of law?
No, I think you can still make these claims. It doesn't say that, you can still make a claim that you're an expert, but I don't believe you have to be, it doesn't carve out that if you're you don't have to be board certified to call yourself an expert or specialist.
Gotcha. What if my qualifications don't meet that claim? What else can I advertise?
Well, if you practice only in certain fields or will not accept matters except in those fields, you're permitted to indicate that. You may also indicate that you only concentrate in or focus on or limit your practice to a particular area of law, as long as those statements are true and accurate.
Question 18, can I charge my client back for fees I had to pay for the credit card service charge?
Yes, this is another recent change. A lawyer or law firm may accept payments under a credit plan, and lawyers may charge the clients the actual charge the credit plan imposes on the lawyer for the client's transaction. So yes, you can charge your client back for the credit card fees, but you need to have that in writing.
It's good practice to throw it in the retainer agreement. 19, can I use a third party for cloud computing?
Yes, lawyers may use cloud computing if they take reasonable precautions to ensure that the confidential information of the client is maintained. Also, that the service provider maintains adequate security and that the lawyer has adequate access to the information stored remotely. It's incumbent upon the lawyer to research the service provider that they wish to use.
20, can I use targeted ads on social media to attract clients?
Yes, you can. Lawyers can deliver targeted ads through social media, but you must comply with the bar's more restrictive direct solicitation rules rather than the general advertising rules that are laid out by the Florida bar.
Question 21, what is a tombstone ad?
Surprisingly, Eddie, I didn't know what a tombstone ad was at first. When I was doing my research on what kind of questions should come up, do you know what a tombstone ad is?
I'm waiting to hear it.
Okay. So a tombstone ad is an advertisement that contains limited information that's listed in the rules regulating the Florida bar. It's things like your name, your address, your telephone number, your website address, whether or not you accept credit cards, prior legal positions you've held, positions you've held in the Florida bar on committees. These are the types of ads that do not need to be filed with the bar for review. So if you're just doing a generic tombstone ad, like I just said, you do not have to give those to the bar for review as if you were going to do, as we talked about before, maybe a more direct targeted ad. You'd have to run that by the bar to make sure that they clear it.
Let's say you have a standard regular ad. What are some things that maybe stood out that are likely to automatically have that ad rejected?
One of the simplest things that lawyers often fail to do is include their geographic disclosure by city, town, or county of place where they have a bona fide office. People tend to leave that off sometimes, and that is required in the advertisements.
What can a lawyer do if they have a bad review online and the person leaving the ad was never their client? Can the lawyer respond to the bad review?
Yes, they can. If it is really a situation where it clearly was not, they're clearly not a client of yours, that lawyer doesn't owe any type of duty of confidentiality to that person, so they can say that this is not a client of mine and pretty much leave it at that. If they were a client of yours, it's not in the rules, but the advisory and some of the opinions are that you should not engage in any way online in trying to dispute the bad review.
Number 20.
But if the person was not a client, you can respond and say this person was never a client of mine.
Proceed with caution. 24. If I refer to personal injury case, do I have to work on the case to get the referral fee?
Why the answer to the question is no. A lawyer cannot get a referral fee just for making a referral. Where a lawyer is not going to work on the case, the lawyer will be required to enter into a written agreement with the client and the other attorney, where the lawyer assumes joint legal responsibility for the matter, agrees to be available for the consultation with the client, and the agreement discloses how much the fees will be shared between the lawyers.
Question 25. How about having a non-refundable fee agreement?
Yes, you can have a non-refundable fee agreement. And as I said before, that there's no requirement that a fee agreement be done in writing. The rules require that any non-refundable fee shall be confirmed in writing and explain the intent of the parties as to the nature of the amount and the amount of the non-refundable fee. One thing to note, that if the client doesn't necessarily have to sign the writing explaining the non-refundable fee, it is sufficient for the lawyer to send a letter to the client that outlines the non-refundable fees. But your best practice is to get it in writing. If it's not in writing, you have to give the client sufficient notice in a letter that a portion of the fee or all the fee will be non-refundable.
Question 26. What is unit billing and can I do it?
Unit billing is a practice where an attorney bills a predetermined number of minutes for a given task. So for instance, maybe a standard motion to withdraw, your unit billing, you might say that's 0.3 or 0.4. So for every motion to withdraw that goes through the firm, we're going to bill 0.3 and 4.4. And no, you can't do it. And the reason you can't unit bill is that it fails to give regard to the actual time you spend on the true legal work, and it creates an excessive fee. So no unit billing.
Question 27. I did a great job for a client and she treated the whole office with a catered lunch from a really fine establishment. Is that okay?
Yes, Eddie. While it's okay for an attorney to accept small tokens, gifts, such as holiday gifts from clients, a lawyer should not accept substantial gifts from a client. I think you and your firm would be okay with a lunch from a nice restaurant that was given to you by a client. Now, if a client gives you a car, maybe that's a little excessive and not and above a small token gift or a box of cookies at the holiday time.
Question 28. What's the best way to handle when a client wants a family member or a friend to sit in on a meeting with their attorney?
Well, while the person may provide emotional support to the client, their presence at the conference destroys the attorney-client privilege. And if subpoenaed, this person and or the client may be compelled to testify as to what was said during the conference. So I will tell my client from the outset about the lack of privilege. I won't discuss anything other than basic generalities. I won't discuss strategy or anything that could hinder the client's case if the information was known by the adverse party. At some point, I will send the third party out of the room. So if they were ever deposed, they can testify that they sat in the first part of the meeting and was asked to leave and have no idea what I spoke to the client about which typically would be more strategy and things one would want to keep confidential in a case. So they can sit in. You have to advise your client that you're breaking the attorney-client privilege, and then your best practice would be have that person, after some period of rapport or comfort level, have that third party leave, so then you can have a real heart-to-heart with your client and discuss things that you would want to keep confidential.
29, what are my CLE requirements?
Well, each bar member must complete a minimum of 33 credit hours of approved continuing legal education activity every 3 years. At least 5 of the 33 credits must be approved in legal ethics, professionalism, bias elimination, substance abuse, or mental illness awareness programs, with at least 1 of the hours in an approved professionalism program. That's a new addition, Eddie. They've added that professionalism program recently. So you have to make sure out of those 5 specialized in ethics, professionalism, bias elimination, substance abuse, and mental illness awareness, 1 of those programs, 1 hour must be professionalism. And at least 3 of the 33 credits must be approved in technology program as well. So just remember, if you complete more than 33 credit hours during any reporting cycle, the excess credits cannot be carried over to the next reporting cycle.
30, how do we stay out of trouble as attorneys?
All right, well, there are 6 easy ways, Eddie. Number 1, if it's not true, don't say it. Number 2, if it doesn't feel right, don't do it. Return your phone messages the same day as possible. Always take the high road. Always place the client's best legal interest before your pecuniary interest. And always be careful with your trust account.
Great words, RT. You got all 30 questions right.
Thank you. And I think I got them in right at maybe the 30-minute mark here. We're coming up.
Yep, we have just earned that half an hour of ethics CLE credit that is so important. So RT, thank you for joining us in the 2nd annual Family Law Mental Health Summit. And now we are going to switch things over to our keynote speakers, the president of the Florida Bar, Dori Foster Morales, and board certified attorney, Laura Davis Smith. Hello, everybody. I'm Eddie Stevens. I serve on the board of directors for the Center for Child Counseling, and today I am honored to present 2 very special awards. First, we'd like to acknowledge Laura Davis Smith, who has been selected as the Center for Child Counseling's 2020 recipient of the Jane Robinson Child Advocacy Award. This award is named after Jane Robinson, who founded the Center for Child Counseling in 1999. Jane has been an advocate for literally thousands of children. Laura is a board certified attorney in Coral Gables. She's a principal with the firm Davis Smith and Jean LLC, and she's the past chair of the Family Law section. She's also a superb human being. The Center for Child Counseling selected Laura for this acknowledgement based on her advocacy efforts for children, both inside the courtroom and in our community. Laura, thank you and congratulations.
Well, thank you, Eddie. I can't believe this beautiful award was waiting for me in my office. And I am honored, to say the least, to have been awarded this. The Center for Child Counseling has been a special part of my heart since you introduced me to it, several years back, when I had the opportunity to co-sponsor an event to get the word out about ACEs. And as a person who has overcome those kinds of issues, it's important for me to give back to kids. And it is the work that the center does is unparalleled, and I am so honored and proud. So thank you so much.
Thank you, Laura. And next, we'd like to acknowledge Dori Foster Morales, who is the principal of Foster Morales and Stone in Miami. She has been selected for the Center for Child Counseling's 2020 recipient of the Judge Ron Alvarez Resiliency Award. Judge Alvarez was a pioneer for creating a trauma-informed judiciary before we even understood the science and the impact of toxic stress on children and the impact of adverse childhood experiences on society. Dori is the most current president of the Florida Bar, and she has made it her mission to bring mental health and wellness awareness to the forefront of its 107,000 members. Dori is truly creating a trauma-informed bar. Dori, congratulations and thank you.
I'm so flattered and appreciative and honored to receive this beautiful commendation. I also have to commend you and the center for all the work you do for the families in Florida. You know, children are our future. You know, we say that, but unless we have healthy children, we're not going to have a healthy society, and you understand that in the deepest of ways. And I'm so excited to be here to talk about mental health, and so appreciative of the work you and the center does for everyone in the state of Florida. So thank you so much.
Well, I'd like to thank you both for joining us today and being the keynote speakers for our second Family Law Mental Health Summit. And I wanted to have a round table discussion with the both of you to discuss some of these topics and get your thoughts. And the first question, I guess, would be, how do you all deal with the stress of this occupation and the pandemic that we're currently suffering through?
Dori, I don't know if you want to start.
Why don't you start, Laura?
Okay. So I find that for me, exercise is hugely important in managing my mental health and well-being. And it was a difficult start to the pandemic in that there was, you know, gym closures, so I wasn't able to go and work out as much as I had been. I've been blessed with a Peloton, which arrived at the beginning of this month, and I have ridden, as of last night, 37 times. So you can see I'm making up for lost time. But I think that exercise and that release of endorphins is such an important part of handling stress for me, and I think also for so many others.
Dori?
Well, I do think exercise is important, and I've been running during the pandemic, and I had created a little Facebook running group with some of my pals to keep me motivated. But I also just think, actually, you know, going to see a therapist is a great idea. And, you know, we all talk about eating healthy and exercise, but I still think there's a lot of stigma to saying, I see a therapist and I see a therapist. So that helps me to stay balanced. It gives me a place to deal with my stresses and anxieties. You know, my family and I all believe in getting help. And, you know, it's not every day that we deal with a pandemic, and the stresses are not just on us, but as family lawyers, the additional stresses on our clients who are already going through a very stressful situation. And we are truly the people that are, you know, shuttling them through this difficult time in their lives. So recognizing that this, you know, incredible additional stress on us based on just what our clients are going through, not to mention, as we all were discussing a little earlier, what our own families are going through, the stresses of kids in school, not in school, the stresses our children are feeling, our spouses are feeling. I mean, these are really unprecedented times. So I encourage folks not just to eat well and drink plenty of water and get exercise. I think those are all really important, but, you know, find a good therapist, you know, that you can speak to once a week, twice a week, whatever, once a month. I think it's a great way to deal with stress.
Speaking of that, Dori, are you aware of any new resources the Florida Bar has for attorneys to maybe talk to a therapist?
So, you know, that was one of the really exciting things that we rolled out in May. I was sworn in virtually as president of Florida Bar on June 19th. And the plan had been that starting July 1st, we would have this new mental health line. But as soon as the pandemic hit, we realized immediately that lawyers were going to be under a lot more stress. And I've been going to town hall meetings across the state by Zoom, of course. And the stress level of lawyers has really significantly increased. We rolled out this mental wellness line, and it is manned 24/7 or femaled. It was by licensed mental health counselors. It's a 24/7 hotline, helpline that is free to our members, free and totally confidential. And I really want to stress the confidentiality because there are a lot of people that don't really buy the confidentiality. But let me tell you how confidential it is. I was thinking at the beginning, I'd like to know what people are calling about so I know what kind of services to provide my members. So I asked the bar staff to find out just what are the type of calls we're getting, not who called and how they called and what time they called, but literally what type of things are we hearing about? And I was told, sorry, we can't tell you. So it's totally confidential, it's totally free, and they will recommend and refer you to up to 3 free mental health counseling sessions with a private therapist. So it's the 24/7 call line plus therapy for free, confidential. I really hope our lawyers, especially our family lawyers, take the bar up on this great new program.
And before the pandemic hit, we were a pretty stressed out profession. In fact, the stats showed we had about 19% of us lawyers suffered from anxiety, 23% suffered from stress, 28% depression, 36% suffered some type of alcohol abuse, and unfortunately for suicide, lawyers are in one of the top 10 professions. Do you have any comments, and we'll start with Laura this time, on creating a healthy work-life balance?
That is a very, very important question, and one that we could talk about for days. But I think that the most important thing, in addition to what Dori said about therapy and the free helpline, which is so timely and needed, I think it's important for all of us to give ourselves the grace to understand that there's no perfect and there's no requirement to be perfect. And I think as lawyers, we spend so much time worrying about getting the case where it needs to be and pleasing the client, and also, you know, pleasing the judge and having a good relationship with opposing counsel. And that is before we even talk about how we manage our family life. So I think that there is a need for, as I said, grace that we give to ourselves. And that includes giving ourselves the permission. If we have anxiety, we talk to somebody about it, and we take medication if that's important, and it's not a shameful thing. And if we can lessen the shame of imperfection and recognize that all of us are imperfect, I think that would go a long way. That's just a thought that I think if more people could hear that and own it, I think that would help quite a lot. I mean, there's no perfect mother, there's no perfect lawyer, there's no perfect judge, there's no perfect anything. So
it seems if you break your arm, you go to the doctor and they just fix it, and there's no stigma with that. Yet our society has created this incredible stigma about mental health and seeking appropriate treatment, and really that's a necessity to have a healthy life. Dori,
yeah, I agree.
Dori, did you have anything you wanted to add?
Yeah, I mean, and I think it's part of our professional responsibility to be mentally healthy. I think we're better lawyers if we're mentally healthy. And I want to point out when we talk about this, that the studies really show that making more money doesn't make you happy. Having the biggest client doesn't make you happy. I mean, there've been lots of studies on this. And one of the things that really provides a lot of gratification is giving back. So it's the internal things. So the externals like money and success and all those things and the accolades, they're nice, but some of our most successful lawyers have committed suicide. So it's not that. So what they show is that, and I always laugh because it was like, well, getting the job at the big law firm or being on law review, none of those things were really available to me because I didn't have those kind of grades and I wasn't that kind of law student. But I think, so I always say, thank God. Maybe I'm really happy because the expectations were so low when I graduated. But the truth is, the truth is that I think that being grateful for what you have, that's proven to be something that really helps your mental health and helps you to balance. Just waking up every morning and saying, boy, it's a beautiful sunny day, or what a yummy cup of coffee I'm drinking, whatever it is you're grateful for. And number two, that you sort of figure out something that makes you feel good. That's really has nothing to do with work. And it makes it easier to balance when you see what else is going on in the world that, you can help with. And it helps you, I think, to balance those issues. Having said that, if you ask my office, they would tell you that I don't have a very good home life, work life balance, and I probably don't practice what I preach right now.
Have you all done anything specific during the pandemic to make sure your clients and your staff and yourself are healthy? Laura, you want to take that one?
Anything in particular? Not beyond what the recommendations of Dr. Fauci have been, which we have employed. There have been opportunities for working at home, recognizing that it is difficult for everyone, accommodating clients on weekends and different times in the evenings, especially when school was ending, and I'm sure it's going to happen again now that school is starting back up again, when people are at home trying to homeschool their children and also working, and they need to fit in their appointments with their attorneys. And the same goes for my business partner and I. We're both working mothers, and it is a real balancing act. So it's making allowances for time for rest, time for work, and to acknowledge that this is a crazy time and we need to step back, take a pause, and really rank the importance of certain things. So,
Dori, did you have anything to add to that?
So there are three words that I keep going back to. We need to be patient. And so I've tried to be patient with everyone. When people are stressed out, I try to, take a deep breath before I respond. We need to be flexible because this pandemic has created stresses that we couldn't have anticipated that require a lot of flexibility. And we need to be creative in our solutions. So every morning I wake up and I say, how can I be more patient, more flexible, and more creative? And when I look at it that way, I'm less anxious. And the truth is, and I don't know how it is for everyone else, but at the beginning of the pandemic, I was really amped up and anxious. I have a staff that I feel responsible towards, an office that I feel responsible towards. And would the firm have the ability to generate the revenues to support it in its current form? I was really anxious. And what I found out was by being patient, creative, and flexible, it worked, at least for us. Now, I know that probably 35% of our members, more or less, that's what I'm hearing, have a reduced income. And so I recognize, depending on the practice you're in, that you have more or less of an ability to do that. But I think family lawyers, if you go with those three words, you will really be able to withstand the pandemic. And those are words you use with your family, your friends, your clients, and your staff.
I've been using some of this time to further my own education, and I started taking a class on Buddhism, and one of the major concepts was struggling with impermanence. And we learn everything is impermanent. And the thing that causes us the anxiety is not the impermanence, but our reaction to that impermanence. And if we change our reaction, it could really lessen the anxiety that's associated with that event. So that's one of the things that has really helped me during this pandemic. And also just doing things like taking a class and taking this opportunity to self-improve. Dora, you've been visiting with all of the circuits in Florida. Have you hit all 20 yet?
No, I mean, I committed to hitting 20 in August and September. So I started August 5th, and my last one so far was on August 26th, and I've had 10 of them. And they're actually, it's a little bit more of a challenge than I thought it would be. It's a lot of work, but I'm getting a lot of really interesting feedback. And some of the areas where I thought people would be the most stressed out, and that would be areas of like the new technology and the new way of practicing law, that's not turning out to be the biggest stress. The biggest stress that I'm hearing about, I would say, is the top three are isolation, practice stability, and home life, work-life balance. So, you know, I don't hear per se that childcare is an issue. It is a focus of some folks, but those are the three big things. And it's sort of the things that I think we need to understand, that people feel isolated, and how can we do better with that individually and from a societal standpoint. I think the stability of the practices, the anxiety of finances, and also because we do these Zoom polls, about 35% of our members are making less money. So all of those things fit together. And the flip side is I'm hearing incredible stories of resilience of our court system, of cooperation and collaboration among the stakeholders, the lawyers, the judges, the clerks, and the voluntary bars coming together, because I bring all the voluntary bars on. And so, you know, and at the end of my town hall meetings, I don't want to give it away, but I do like, my takeaway is always, you know, tell me the most positive thing that's come out of the pandemic, because we know there have been incredible struggles and difficulties. You know, my husband runs a city. I mean, the city that he runs is run really primarily on visitor and convention bureau dollars. So those went to, he was excited when he learned that he thought he would see a 75% drop. And that's a big revenue drop. It was only 70%. So that was the silver lining, right? So I just think that it's not just private sector, it's not just public sector, all of society is feeling this. So, you know, what I'm hearing from the town halls is really, I think, mirrored in what we're seeing in society.
I'd like to turn that question around on you, Dori, and ask both of you what good things that you have seen come out of this pandemic.
Well, I'll go first.
Laura?
I have seen people developing hobbies that they didn't know they had the desire to pursue. For example, indoor plants. Some people, like myself, have become obsessed with growing things to make our surroundings beautiful and healthy. I happen to know quite a lot of people have been attempting to make sourdough bread. It's not as easy as it sounds. And the pulling together of families and the realization that now matters. You know, we hear all the time, live in the present, be in the present moment. Really, that is a truth, and to recognize it, I think, is a big gift, to realize that we can be with our families and stay healthy and be supportive of each other. And it's only going to, you know, reflect outward like the sun's rays to the people surrounding us. So I think for me, that's been the most important thing, is to really recognize the need to live in the present and be grateful for the things that are positive, like that opportunity that we've been presented with.
Dori?
So personally, I'm sure there have been lots of great things that came out of this pandemic for, you know, on societal levels. But for me, I learned that I could work at home. I mean, I'm a pretty hard charging lawyer. Most people know that. And I never thought I could work at home. And I can work at home. And that, you know, the pandemic required me to be flexible to be able to do that. And that's been great, because quite frankly, this week I've been working mostly at home. When I dropped my son off at college, we spent a week in North Carolina, and I did town hall meetings and I did work. And so learning that I could train my brain to work at home. And the other thing is, who would have ever thought I could do a whole evidentiary hearing with a client in Bolivia, you know, and another lawyer, you know, lawyers in Fort Lauderdale, client in Bolivia, another party in Louisiana, without, you know, travel and, you know, the schlepping the boxes to the courthouse. And I think it's been remarkable how we have pivoted. And I will tell you, I'm going to be the first to tell you, and probably not the last to tell you, it's not going to change. I am confident that non-evidentiary hearings, by and large, are going to proceed in the future virtually. I think people are longing to get back to the courthouse. I'm glad we have the platforms to do what we can do, and we can keep the third branch of government moving forward. But I just think it's been remarkable. You know, if you've ever watched anything about the courts and technology, they are slow to move. And there's nothing like a pandemic to get the engines roaring on technology. So I think, you know, for me personally, the fact that I could do things that I didn't think I could do, and to see the courts pivot the way they have is pretty remarkable.
The acceptance of technology, and I'm so impressed at how the judiciary has responded, because at least in Palm Beach County, we had very little downtime, and we were doing Zoom hearings almost immediately. And while everybody struggled a little bit at first, at this point, I think I've done 40 court appearances with full trials, including one trial that had about 40 different exhibits that we were able to maneuver throughout the day. And the productivity and the fact that I don't have to drive to the courthouse and wait and get there 15 minutes early, I see that is a huge cost savings for our clients, because they're not just paying us to show up at the courthouse. And while I think it's a better presentation to be in front of a judge, and I've always avoided phone-in appearances, because I think it's important to be there. But with the pandemic and these forced changes, I think it's good to adapt, and that adoption that certainly has some financial benefits for everybody.
Eddie, I want to just jump in and say one. I want to add one point about what you're saying, because I think it's the one thing that we all need to be very focused on. The fact is, we're going to have to change the way we schedule our lives, though, because as much as we're able to schedule back-to-back Zoom hearings, we need pockets of time to decompress and go to the next step. And I find that the scheduling is going to be different, because you know, you just can't, just because you can physically turn off a screen and turn on another screen, you still need a moment to breathe. So my recommendation is, because I would say that's one of the biggest challenges for me, is that people pack my day and give me no time in between. And it used to be, you know, you walked to court, you chit-chatted with some people, and even if you went from one hearing to another, there was like mental downtime or drive time or whatever. I have people scheduling me to meet with a legislator, and then literally, like, immediately starting a town hall meeting. And I've said to people, look, we're not avatars. We need natural breaks. So I think that's the one challenge that we're going to need to really work on.
Well, I think we have time for one more question for you all, and I do appreciate both of your times in spending this moment with us today. Do you have any other things that you would like to address about the topic before we let everybody go? And I'll start with Laura on this one.
Anything additional? No, I think that the key is to really be aware as much as you can of your own thoughts and what your needs are with respect to taking care of yourself and those around you. You know, we as family lawyers have a lot of responsibility, not only to ourselves, but also to our clients. And as I mentioned before, our children. It's critically important to listen to what we need and to ask for it and to take the offers of help that are being presented to us by way of the anonymous self-help line, for example. This is an unprecedented time. We are here. We are alive. Those of us, who have survived this COVID-19, and we have lessons to learn from it. And I think that we need to make ourselves as healthy as the flight attendants say. If we get back on planes, put your own oxygen mask on first, so you can be of help to others.
So I'm going to end with a shameless plug. And the shameless plug is there's a lot more information and assistance available to you from the Florida Bar than people realize. So for example, we have a special COVID-19 webpage, and I know Laura's on the task force, and thank you, Laura, for accepting that appointment. Very important to me to have you on that committee. And there's a lot of information that will make your life easier. So one of the things is, don't be such a fighter pilot. There's help out there, whether it's for CLE credits. So if you go to the Florida Bar webpage, and there's like a little banner running across, it says, COVID-19. And it's got all the information from all the different circuits and from the Supreme Court. It's got special CLEs. It's got employment opportunities for people who need employment opportunities. There's so much information. It brings you to CLEs, wellness tips, breathing tips. I mean, the YLD, the Young Lawyers Division, is going to do a whole month on breathing. And, take a moment to breathe. But go to the website. We're really trying to provide resources and assistance, and avail yourself of those fees that you pay to the Florida Bar. Thank you.
This brings an end to the second annual Family Law Mental Health Summit presented by the Center for Child Counseling. We'd like to thank all of our speakers today, and we hope to see you again next year. Be safe and do something that matters.